感谢沈老师，是登录没问题，现在就是中午还没打开，只有一个人在线，再等一等，人有点少。Hi, hi, good morning.
Morning, yes.
Can you hear my voice?
I hear you clearly.
Oops. Hi, good morning, everyone. Can you hear my voice? Okay. Good. Well, it seems like we just have few people here. It doesn't matter. We can start now, and then if they join later, it's fine. Sorry, I'm literally in Beijing currently at this moment, so that's why this is later afternoon, and it's a bit. Okay. So, because since COVID travel ban is lifted, so looks like normal now. So that's why I'm come back with my because of that reason. So I can't really do the face-to-face teaching. So it just changed to online. And today, this last module, if you like, sorry, it's a bit noise outside, to talk about golden chamber synopsis. But actually, this is not golden chamber synopsis contents. Today, the contents is purely to do with something else rather than golden chamber synopsis. I think if you have learned sorry. So if you know a little bit about golden chamber synopsis and Shanghai Lun, and I think you will know what's the difference between these two books, very important books. And last 7 days or full days talk about golden, all the contents is all really completely come from golden chamber synopsis. So I try to talk the most commonly seen diseases and most commonly seen conditions and formulas, and we try to grab some ethos of traditional Chinese medicine, and particularly with a lot of already twisted or sometimes somehow, I mean, maybe already lost of very valuable thoughts about Chinese medicine to these particular diseases. But to try to make this whole course more relevant, that's why I put the final bit to do with the external cold, flu, or other seasonal diseases, because we see this kind of problems very often, and unfortunately, this part of information or this part of contents normally is not talked in the golden chamber synopsis, or even some formula discussed in the golden chamber synopsis, but is not talked in the aspect of treating the external diseases. So really, today's contents is completely, it's not really come from golden chamber synopsis. It just try to help us or try to help everyday's practice, because when we're doing, particularly in my practice, for example, I think I probably do about 20-30% of the people come to me is to do with some like general cold, flu, cough, and the last 2-3 years since COVID pandemics, probably more than half of that, what I'm dealing with, is to do with that. So it's quite a big chunk of our everyday dealing conditions. But those conditions is not really concentratedly or not really properly discussed in the golden chamber synopsis. And that means was the formula we learn in the golden chamber synopsis. For example, we learn the feng shui, for example, as really is to do with external pathogenic factor attacking as well. But even that, we'll talk as the directions is not really to dealing with a general whole structure of the external syndrome complexes. So that is one thing I want to mention first. Secondly, the content today came from mainly from 2 major books, and also most of them came from my clinical settings, what I, over the years, what I'm normally using the formulas. The 2 major books is one from Shanhan Lun, one is from Wen Bing Tiao Bian, which is Shanhan Lun, which is cold damage diseases, or called treatise on febrile diseases, which is the most important books about the pandemic diseases, which is the same book, actually is the other half of the golden chamber synopsis. Actually, yesterday, one scholar in Beijing about Chinese medicine, we did have to brief discuss about difference between the 2 books. Because Shanhan Lun is much more well-known, much more well-discussed, learned or studied. And inside, the more than about 103 formulas being discussed, and most of them we're still using every day or in Chinese medical practice. And yet, 金匮要略 or golden chamber synopsis, which contains about 225 or 252 or 62, I can't really exactly remember, because depending on which way you counting that, because there is actual formulas inside. And as less likely discussed it, and one of the reason is because Shanhan Lun have very complete, much more logical, easy to grasp systems, like structures or framework to help us to understand the Yi Sheng's real thoughts behind the formulas. And but what's but in my opinion, the golden chamber synopsis seems far more wide, far more wide covered. So that's what that's a bit slightly slightly not very relevant to what I'm talking today. But you see, part of it is from there. It's because in Shanhan Lun, the cold damaged diseases being discovered, and the other part from Wenbing, which is heat strike, and Wenbing Tiaobian formula, we also have something to mention. So that is two major sources what I'm talking today. So firstly, I will have a brief introduce of what external pathogenic factor cause diseases, what are they, and what is the difference, and how the different system, what I'm talking today, how I introduce, the way I'm introducing it, and what's the logic behind my whole PPT, whole instruction of today's teaching. Firstly, we should understand or should try to distinguish the external and internal. So what is external? What is internal? If we say boldly, external and internal always talk about relatively. So for example, the Zang and the Fu, Zang is more internal and the Fu is more external. But in here, when we talk about external and internal, we more talk about to do with skin surface and internal and deeper than skin surface. So that's what really this is what today we're talking about external symptoms at all. So, for example, like small intestines and heart, small intestines external and heart is internal for organ. But today we're not talking about like external, like small intestine channel. We're talking about external of skin, of body hair, and solely this level, because that is the first layer of our defense system in respect of fighting with diseases came from outside. So that's what external really means today. So that is, we call it biaoli. It's not quite boldly talking about biaoli. It's more pacific with what's the problem first. Secondly, we have to understand external. When we talking about the solely, talk about the body hair, talk about the skin, talking about like skin deep defense system, as there's a few organs directly attached or supported this kind of external layers. So the most well-known one is肺or lung. We know that in Chinese medicine, lung is in charge skin surface, or we call the 肺主皮毛. Basically, if directly translate is lung is in charge skin and body hair. Skin and body hair is basically its first layer of the pathogenic factor attacking. But if we just want to talk about Zang and Fu, normally Zang is internal, Fu is external, but actually lung itself is Zang. So Zang should be internal, isn't it? If we're talking about. But in 5 elements, the metal, or in 5 organs, the lung is in charge, the first layer of the body, first layer of defense is, for instance, like if we eat apple, the apple skin, we believe is belong to lung, or the pear skins belong to lungs. So that's why in Chinese medicine, if we want the herbs, for example, if we want treating some people who have the lung disease, like a cough, like sneeze, whatever, we normally use skin. We use the skin of pear, skin of carrot, skin of moly, for example, to cook particular thing, or we use particularly choosing the skin of pure herbs, like for example, like chen pi, which is 橘皮, qing pi, and those kind of 大腹皮. 生姜皮, particularly the 生姜皮, the skin of ginger, to treat lung diseases. That is why. So in 5 elements, although the lung organ is 脏, is internal, but actually lung itself in 5 elements is in charge superficial resistance and skin surface. So because by Yolande internal classic, lung is in charge 皮毛, which is skin and body hair. Secondly is bladder. Bladder we know is a full organ. Bladder is external relatively to kidney, but the difference is blood channel is a 足太阳 channel. So in here we talk about bladder, we talk about channels. Actually, bladder is right at the bottom of our body, but bladder is where the yang, where the qi transforming program is going, where the qi hua is engaging and activating in that particular part of the body. So therefore, the blood organ itself and also the blood organ in charge are connected, the body channels called 足太阳. 太阳 is the yang, the largest yang or biggest yang. And also blood channel, we all know that is the most longest channels in our body. So in charge, the yang surface. We know compared to the body, compared to the yin, yang is external, it's outside, yin is inside. And the inside of yang, the 太阳 is outside, and the 少阳 is middle, and the yang means internal. So bladder is the first layer of yang, or first layer of defense in aspect of cold damage. So if the cold damaging our body, the yang energy will be first being affected. So therefore, the yang energy will became front line to the cold damage. But which channel standing in the first line to dealing with the issues? That will be the bladder or blood channels. So that is one thing we also have to bear in mind. So when the strike happened from external pathogens to the body, so they could be going to the lungs, they could be going to the bladder, because lung is body surface in charge, and the blood also could be charged body surfaces. So surfaces. So that is very, we have to always bear in mind of those two. And in fact, if there's a cold damage, more likely blood channel or 足太阳 channel will be first affected. And if it's young, more likely, if it's a young pathogenic factor, if it's a heat, for example, or warmness, this kind of pathogenic factors, more likely the lung channel in charge. It's not only because lung in charge, the hair and the body skin, body hair or skin, but most importantly, because the opening of the lung is in the nose, and the nose is in front, and the front is where the yin channel is supposed to be, and the yang energy or yang pathogenic factor more likely attacking or consuming or exhausting the yin energy, and the lung will be suffering. And also we do know, in the first modules we're talking about, the lung is a fragile or sensitive organ. So that's why any kind of cold, heat, any kind of imbalanced or kind of harsh changes of the environment energy will be have the impact to lung channels and organs. So again, I want to be clear is when we talk about the lung and the bladder, we not only talk about organ itself, we not only talk about channel itself, we normally talk both. So that is why sometimes can be very confused. But in the clinical settings, we see both. For example, particularly for some people, if they have cold damage, they could have headaches, body aches, particularly the back of the neck very stiff, which is where the 太阳 channel being suffocated or being strangled. So if that is the case, we know the blood channel is being affected. But we also see very often, actually, lots of people in the winter, particularly if they had cold damage, they frequently have the changes of their habit of peeing. They may be frequently pee, or they may be peeing with discomfort. That means your blood channel itself, also blood organ itself, also being affected. Although when they came to us, they maybe ignore, they don't tell us the problem they have. They think, oh, I got headache, I got cold or flu, because I don't drink enough. That's why I'm peeing a lot, or maybe because I'm sweating, I'm peeing discomfortably. But we have to realize in Chinese medical theoretical system, that means blood organ itself being affected or being attacked. So that's why we should not only treating the channel issues, we also should treat organ issues. So there's not in Chinese medicine, I don't think there's a very clear cut in between. But sometimes our body, the organ, our body reactions on the pulse and tongue diagnosis can help us understand what's going on. Another two channels a bit more kind of complicated. The first one is triple warmer. The triple or sanjiu. The triple warmer is more, we know by the Yellow Emperor's internal classic, there's a very well-known saying, which I talked quite a few times as well. I repeat again, we call the 凑理 三焦膀胱者凑理毫毛其阴. It basically means 三焦 triple warmer and bladder, they're reflecting or reacting or they're manifested to 凑理 and 毫毛. 凑理 we know 凑 is 基础 is skin, and the 理 is the patterns of the skin. So which is basically talking about 凑理 is the skin and the real skin, if you like, because why the skin is looks like skin like that. There's energy supporting behind the skin to be a skin. Someone's skin very fine, someone's skin is a bit rougher, someone's skin is thicker, someone's skin is thinner. All those things, all because they're supporting energy behind it, are different. And the triple warmer is the channels in our body who delivering or who supporting such phenomena, if you like. So triple warmer is where the energy of the skin and the solely energy manifestations going on, supporting the whole energy going on. And we also in Chinese medicine, we know triple warmer have the most important function is the whole body's qi transforming program is connected or joined up by triple warmer's normal functions. That's why in the Yellow Emperor internal classic, there's a very well-known talks about 上焦如雾, 中焦如沤, 下焦如毒, which means upper warmer is like clouds, like a steamer, and the middle warmer like a melting pot, like a reacting pot, and the lower burner is like a duct, like a tunnel to get rid of the waters and waste. So, and that is not, they are not really talking about what the organ, the physical, not only talk about physical food processing, it's also including qi transforming program, and also this triple warmer are organized very, very smoothly connected, make these three part of sections of the qi transforming or processing programs going smoothly. So that's why triple warmer is where the qi get in and out, getting promoted, decreted. So it's a very important part of it. And most of the books, all the doctors, we less talking about triple warmer. We're more likely to later we talk about formula, I will talk more. We're more likely talking about the symptoms individually. For example, we like, okay, there's particular herbs good for sore throat. B particular herbs good for, like headaches. It's all the single symptoms of our body, which like a cold or heat affected diseases. But we easily forgetting about triple warmers' major contribution to this qi programming, transforming smooth connections. So if we don't if we don't realize that, then when we come to the more complicated conditions, for example, if somebody have the chronic issue, medical conditions, or the pathogenic factors being lingering on in the system prolonged for a while, and our body's immunity not able to keep the triple worm smoothly going, and then we found our formulas no longer working as it was expected. For example, you found, okay, A herbs good for sore throat, but you gave the A herbs to someone who have sore throat, but it doesn't work. And we maybe think, oh, we're choosing wrong herb. And it sometimes could be because the triple worm system not able to keep the whole processing program going. That's why in the late time, in the Ming Dynasty and the early Qing Dynasty, there's a Wenbing scholars of heat, worm damaged diseases, or we call the febrile epidemic diseases. They create a very, they highlighted very valuable, which I think is a very valuable ethos about Fen Xiao, which is really work on the triple worm. And during the COVID infections, I myself using the ideas very, I have to say, I very benefited quite a lot. Stomach channels or stomach clearly is internal organ. It's internal, it's not external. But why we still listed stomach is external is because some pathogenic factors, for example, they could attack our body first to do with stomach. For example, if we're eating the food, we're eating wrong food, we're eating the toxic food, they will directly reach the stomach and causing, for example, like so-called like stomach flu, or like this kind of issues. So that's why stomach organ always is not a skin surface. Stomach actually even not in charge skin surface, but because the food can come to the stomach first line and go causing infectious diseases. That's why the still is major issues. And the damp pathogenic factor is more likely attacking the stomach first. So that is firstly, we try to understand what external and internal the terms really means in Chinese medicine, body will and the particular contents. And we also should connect it, the external symptoms we are today talking with our body channels, which organs more likely, or which channel more likely directly involved, which is lung, bladder, which is easy to understand. But with triple wormer, it's very likely to be ignored or being, we don't know what, we normally don't really can see direct meaningful help from it. Maybe we know triple wormer made to do with it, but how we can make triple wormer functions, how we can help triple wormer's function going on, and that is easily being ignored. And then stomach is another, we probably not quite easily connected with external pathogenic factor caused diseases. So that's the first one. So because we don't have many people, so if anybody have any questions, you can open your speaker and you can talk about it. We can, in case later I forgot about it.
Yeah, Dr. Chen, may I ask one question, please? Good morning to you.
No problem, yeah.
In Shanhan Lun, Tai Yang is bladder and small intestine. Why not lung as well? Why isn't lung included? I know you explained the difference between the organ and the channel, but the reality of external diseases is probably half of them affect the lung, I mean, fairly quickly. And lung is also responsible for the skin. So I just wondered, when I read Shanhan Lun, I did wonder, he has lung is traditionally put further in the deeper layer. So I just wondered why he doesn't include lung in Tai Yang.
The most important thing is what I'm understanding in Shanghai Lun is because Shanghai Lun, Shang is damaged or caused.
Yeah.
Han is cold. So talking about cold damaging, the characters of the cold damaging, and the cold damaging will be the yang, will be the first line. That's what I just momentarily said, because the cold directly is consuming the yang. So lung is not the first line, because lung is not a yang organ. So that's the thing. So that's why when we talk about Wen Bing, lung is in the first line. So later, that's what I mean. In the six pathogenic factors we call Feng, Han, Shu, Shi, Zao, Huo, wind, cold, humidity, damp, dryness, and fire. The six pathogenic factors are attacking body in the different way of doing it. And the Shanghai Lun just mainly reviewed how the cold damage is going on. That's why yang channel is the first line.
Thank you.
And, but in fact, really, most of the cold damage diseases, they're not deliberately going to the lung. The lung is secondary. For example, most people, when they have cold, the typical classical cold, they feel cold, they feel very, like a heavy, sleepy, headache. Normally the cough, even nose running, going second. When they have a cough, normally it's a secondary stage. So that means, and that cold really is not really deliberately caused by the lung itself. It's caused by the yang weakness. That's why Ma Huang Tang, in fact, is really focused on supporting the yang. That's why Ma Huang's character, Gui Zhi's character, Gan Cao's character, there is one supporting chain of yang energy rather than adjusting the lung functions.
Thank you very much. Dr. Chen, just one other question, because you're such an expert on Shanhan Lun, if I may. The gating mechanism for yang, the gating mechanism for yang, so Tai Yang, Shao Yang, the pivot, and then the three. Does Tai Yang, is the idea that Tai Yang opens in the day and closes at night?
Not really.
So how does the gate function?
Gate function. Let me do this way. For example, Shanghai Lun is a great contribution. Is Shanghai Lun draw a very different layer, like a map of the cold questions getting to the body. Just like, for example, how the thief get to the door and where they go in secondly, and how they finally reach the, for example, reach some of the course room of the building. So that's in this one. So Yi Sheng very creatively marked 6 levels. So in this 6th level, we can see divided can be a 2 level with yin and yang, which is the yin and yang level. And in between the yin and the yang level, there's also separated to 3 levels. And in middle of that, so-called pivot, so the shu level, which means in that kind of condition, almost like a degree, like grade 1, 2, 3, 4, 5, 6. And but how do we mark? Of course, this all came from clinical settings and the symptoms patients who manifested. That's all came from the facts, not from imagination. But the pivot situation is basically where the one stage transforming to another stage, like in the middle of transforming. That's why it's called a pivot situation. Do you understand what I mean? Or do you agree with what I mean?
Dr. Chen, at night, the Wei Qi goes from the surface into the body. So that's
Yes.
the mechanism.
That's right.
And I was wondering if that is
The
related
evening-
to the pivot.
Yeah, exactly. But it's not really related to the not directly related to the pivot.
Right,
It's different thing.
right.
So in the daytime, for example, in our every day, well, everything is yin yang change, and maybe we can find a very narrow period of yin yang both appears. It's almost like a border between the two towns. Will be a buffer zone. There could be A town, could be B town. From A town jump to B town is easier, just like that. So in the daytime, the one thing we can clearly know is the sun and the moon. Sun and moon's exchange made our day and night became noticeable. So in relation to our body is a yang yin, where are they in charge, which is wei qi and the yin qi. So when we're in the daytime, for example, our yang qi will be floating on the surface, and in the evenings, or when we sleep, the yin qi is floating on the surface. That's what is really more solidly to see that. Of course, all those things in our body will be delivered by our different organs to in charge such activity every day. In Chinese medicine, we believe, like for example, a certain organ like a heart is clearly core of our organ, heart and kidney is clearly core of our organ, like lung is more clearly external of the body, so this is clear. But also there is a stages in between make this smooth transforming happening, which is like you call like a pivot, like which is Shaoyang or Jueyin channel any change. In organ, the liver will be the organ, or gallbladder will be the organ. Even the lung sometimes could be organ to in charge this kind of day and the evening change. And the wood, like liver and the gallbladder in charge is a seasonal changes. That's when I'm talking about the liver. I think you remember what I'm talking about. Liver is the organ, have yin yang double characters. Because this kind of yin yang double characters, we call it the body is yin and the function is yang, because it's such a yin yang characters. So that is manifested in our body to make this yin yang change in the middle of stage happen. That's why we call this pivot. That's what that's what I'm understanding. So reflect our bodies. Example, when it reflects our bodies symptoms towards the cold damage. Later I will talk. That is means there is a stage of the patient suffering have yin and yang both characters. That's why we call them pivot.
Thank you very much. Thank you very much.
But if we talk about the heat damage, you don't see such a pivot situation anymore. You see, that's what I want to say. The Shanghan Lun, actually, Shanghan Lun is successfully reviewed or drawn a very clear chart of how cold getting to our body is map of the cold damaging, but only to do with cold. So if it's damp damaging to our body, the 6 channels no longer, the cold damp no longer follow the cold damage disease.
Thank you very much.
So so today actually is I can only briefly introduce this kind of system because really Shanghai Lun itself need maybe a couple of years study. But I just try to give you a rough clue. When we in the clinical settings in the future, when we see the disease, we roughly can understand what they are and which formula we can use, and most of the time we can get some successful feedbacks. That's what my main aim. So my second PPT is talking about they try to locating which zang and the fu being affected. So firstly, lung. How do we know lungs involved? How do we know the lung is being affected? For example, if someone came to you and said, "Oh, I don't know what's going on. I don't feel well." And how do you give them answer? So you can, of course we can see the pulse, we can see the tongue, but for pandemic diseases, for very quick pandemic diseases, you're probably not able to find a lot of information from the tongue, because the tongue maybe not change. Well, can be, but not always can be changed so rapidly, particularly if you don't know what the patient's normal tongue looks like. You can't really tell straight away. Pulse normally we can much easier to find out. But again, they need a very relatively good, comparison and training. So if we take the symptoms, more easier to find out. For example, if the lung being affected, because lung in charge the skin surface, hair and body hair and skin. So when the lung is being attacked by pathogenic factors, then our skin and body hair will no longer function as it should be. So we will no longer feel that our body is harmonized towards the body towards the environmental character, the environmental temperature like we used to be. So someone you feel, just feel a bit chilly, or feel a bit hot, or feel a bit, doesn't not necessarily have to be chill. It feels some kind of abnormal change of temperatures, as could be to do with lung being attacked, which you can ask them, and you can maybe something you can feel them, you can sense them. For example, if you say, oh, do you feel cold? So I don't feel cold, but if you touch their skin, the skin cold, or the skin is really relatively hot, for example, you can see there is some pathogenic factor engaged in the body surface, in the skin and the body hair. That's why the temperature adjustment changed. But sometimes, very often, they can say, I don't feel cold, I don't feel hot, but I don't feel right, which is, I do find is very often the answers could be like that. So I don't feel right. I just feel maybe, maybe feel, but I take my cold. It's okay. Same as I used to it. So that is typical early stage situations. But at least it's indicating the temperature adjustment, or so-called immune adjustment, is something gets wrong. So the superficial resistance no longer function as it should be. First. Secondly, it's running nose, because we know in Chinese medicine, nose is opening of lung. So when the lung is being affected, not necessarily have to be a general cold in the whole body. For example, like a couple of days ago, I'm in the evening, mid of night, I'm going to meet friends in Beijing, and then come back and walked a bit quite distance. And I think I just learned actually a couple of days ago. This time I came back to China. This is quite a few years back actually. But the air quality is not so good. The few days are pretty dusty. I mean a bit dusty. I don't know what's going on. And then a few days ago, yesterday actually, because since I'm being here, I was busy. I just don't see the news anymore. I don't really follow, my routine changed. And then just like a couple of days ago, someone sent me something I clicked into. I just realized it's because there's a volcano thing that happens in Russia, and most of the northern China being affected. So the polluted, because this time I found the air pollution or air conditions worse than last time I've been here. Noticeably, particularly that day I was working quite a long distance with my friends, I noticed it dusty. So after I came back home, my nose is dripping. My nose literally is like a dripping. So I know my lungs being affected. So I immediately take some herbs, some herbal formulas, which is Tongxuan Li Fei Wan, take half of the pills. And within about a matter of 2-3 minutes, I feel some kind of different sensations. And then half an hour later, the symptoms stopped. And the very next day, it's fine. So even it's not cold, even it's not about the lung, I do believe that's the lung channel being affected. So that's what I mean, running nose. And that's also applicable also can including, for example, like hay fever, allergy. As long as the nose is running, more likely the lung channel or lung organ being affected, regardless what is the cause of it. Either the chemical gas or chemical toxins attacked, or because just general cold, or maybe someone swimming, breathing some water, or wherever the symptoms. We don't care what's the cause of it. We only care how our body responding to it, and they indicate how our organs being affected. And then if we help our bodies, supporting our body to heal ourselves, symptoms normally should go, or at least should go some positive feedback. Secondly, well, another one which is more typical. We know if someone cough, we know his lungs being affected. So it's very easy, but the cough can be all various kind of cough. For instance, could be very productive wet cough, nervous cough, and dry cough. The phlegm can be thin, like a drip, like clear, like water, or could be very sticky and hard to bring up, and sometimes could be blood or whatever, but doesn't matter what. As long as there is a cough, that means lung is being affected. Maybe not directly, but it could be secondary. So if someone have cough, when you're treating people come to you, I always ask how long and what do you think started? It's quite an important question. If you want to ask them, if it's clear, you don't need to ask, it's different matter. But if you ask how long, is quite important. For example, if someone had cold, oh, I wasn't feel well for a few days, but today I'm starting cough, and the lung is not the first side of damage. There is secondary cough, so you should dealing with other things, and the cough maybe not quite the first. But maybe someone says, oh, I just suddenly starting cough, and slightly, but today I don't feel well. So, and then cough, the lung is in the first stage of damage, and then starting spreading to whole systems. So the how long and what is trigger, how the cause did this started, when we analyzing the symptoms to try to find out what the cause behind it, is quite important to know what's the stage of it. Of course, with lung, the pulse can easily tell. For example, if we take the pulse, you found the patient's the twin pulse, the upper part of the pulse, very floating, acting very, very active, and you can easily understand that is caused by. That means lung is being engaged, lung is in damage, and so on. And the tongue also can tell us. For example, if the tip of the tongue have a showing abnormal in size, in shape, in texture, in color, and also coating, and then more likely the lung is somehow engaged or involved. So that's not very difficult to figure out. Again, if anybody have any problems, just try to raise up and we can talk about it. Yeah. That's first, lung. Secondly, to do with the bladder. So how do we know bladder channels being affected? So it's aches and pains. Because we know in Chinese medicine, the channel of bladder is 太阳. Tai is big. So we in Chinese language, we call sun 太阳. So sun is 太阳. So that is Tai is big. Giant is even bigger than big. So in Chinese writing, Tai is the big plus one dot. So that basically means that even bigger than Da, even bigger than big. So that is 太阳. So yang energy. So basically is, if we think about in Taoism, and particularly in Taoism and Buddhism also talking about in Confucianism as well, we are, in modern science, the life is far, it's a small unit of energy. If we think about it, we are really like if we use some kind of temperature cameras, we are just kind of group of the energy, like fire or whatever. So 太阳 is the most surface layer of the fire. But like the flame, there's the most hottest layer of the fire. So if we're strong, we're yang is strong. But if so all the bodies, skins, joints, all being supported by this kind of yang energy. So if the blood channels function normally, we should feel free, the real free content of self. But if they're no longer the case, for example, when the cold starting attacking our yang, or damp starting attacking our yang, or wherever the sympathogenic factors attacked our yang energy, made our yang energy no longer able to supporting like what should be. And then the most outer layers of our body will be affected, which is blood channel. So which is almost like, when the countries have issues, the first one is like, the most less important or most far away from the capital will be showing the, weakness or showing the depletion of the supporting and the strength. So that's what Taiyang channel is. So when it's no longer able supporting it, so the aches and the pains, numbness, heaviness, all this kind of stiffness and uncomfortable will be starting to develop. So also because the the blood channel is right in charge of the back of the yang. So therefore, like a headache, neck stiff, neck ache, and the back ache, upper back stiff, lower back ache, lower back like lumbago or heaviness, and also the behind the thigh, behind the kneecap, feel very heavy, feel like a very restless. I treat someone long time, have like restless legs. But when I palpating the patients, there's all this kind of the patient points out the discomfort all on the back, particularly behind the kneecaps, very heavy. But when I palpating it, I cannot find a particular point he feel the pain. So I palpating this. I feel fine when you press it. But there's where this you're pressing is where I feel bad in the evenings. But when I'm pressing it, it doesn't feel any pain or whatever. So which means those kind of pain or aches is due to functional impairment or lack of support of yang energy, rather than if there's a damp, if there is cold, if there is a physical blood stasis, if you have clear inflammations or damages there, and then patient able to clearly finger point where its damage is. So with that condition, doesn't matter how long symptom been going on, we know the blood channel or yang energy of our blood channel being blocked, strangled, or being weakened. So when we see this kind of, I don't know, in my personal experience, most of MS patients is like that. No, most, maybe more than half. I have to say more than half of my MS patients I'm dealing with and aches and pains, they are cold damaged disease or cold involved damaged diseases. And the blood channel always is one being affected. But another thing we have to be, I don't want misleading is aches and pains not only happen in the blood channel, also could happen to the gallbladder channel, could happen in stomach channel, could happen in the other channels as well, even, for example, like even kidney, spleen channels. But kidney and spleen channels normally, they're not aches and pains in the joints and the skin surface. They're more likely to do deep internal, like inside pain and aches. So there's different. When we talk about external pathogenic factor causing diseases, the pain and the aches is more to do with muscle, skin, the surface. And again, there's also few symptoms like the skin nerve damage. You see some patients, I see when I do the acupuncture, some people I can't even touch it. Actually, I even hasn't touched it. Needles hasn't even inserted. I feel, oh, so painful. So like that. It's almost like very dramatic. But that means the cold being blocked in particular area badly. So normally, if you use the heat lamp or moxibustion, normally the pain can go straight away. And when you're dealing with this kind of conditions, if you insert needles, you don't need inserting very deeply, because that means the pathogenic factor is stayed or attacked very thin layer. It's just in the skin surface. So that's also quite important to know that. So the pains and aches, particularly alongside with the blood channel, is one of the major symptoms with blood channel or 太阳 being attacked by cold especially. And also chill and feel frozen cold. Some people can, which is we all see, we very often see patients like that. They have high temperature, but they feel really shivering, cold, very cold. But the body temperature, if you touch their forehead or even close to their forehead, you know they're in high temperature, maybe 39, 40 degrees and so on. But they feel so cold. They put, doesn't matter how many layers of clothes they put on, they feel cold. And this kind of condition is all to do with yang energy. That's what just a moment what I said. Yang energy being covered up. I use the words being strangled, completely being suffocated, being strangled. So they cannot, the yang energy being bottled up inside, cannot reach the skin surface and cannot reach the yin wei level. That's why the yin wei level no longer able to protecting us. And then the chill and the cold, even frozen. Some people I see in a couple of cases, particularly for younger kids, they're so cold, their teeth even shaking. You can hear they kind of like, but if you feel their skin is not cold, they're hot. so with those kind of condition, it's good because blood channels being affected. Again, because blood in charge of water work, so water work disturbances very often happen as well. But patients maybe don't realize, or maybe they forgot to mention to you, but that's often happens. So I normally ask, are you water workers? Oh, I'm fine, I don't feel too much, And then if you ask more details, you found they will notice there is some change, not quite they used to be. So it's blood channel. The third is triple warmer. Triple warmer, that's just what I said. The triple warmer is very, I think I said before, triple warmer is a very unclear terms in Chinese medicine. I mentioned it before because triple warmer, some scholars believe is one particular organ or channel. Some scholars believe triple warmer is just to try to make the whole 11, before it was 11 channels, and then make 12 channels, try to make them more kind of like impair. And also triple warmer itself, it's just showing a whole, like just what I said, the connections of general performance of our body, not in particular organ. But myself, I don't want to go into this too much. I think I told a little bit before as well. And I do believe triple warmer is an independent organ and is very important as well. Because triple warmer is in charge of our bodies. And particularly in my clinical settings, I do see the patients have clearly triple warmer headache, for example. So the triple warmer channels, that's what I put this chart here. We know there's this is bladder channel, there's a stomach channel, there's a stomach channel on its head surface, there's a gallbladder channel, there's triple warmer channel, and those all the headaches which is caused by the pathogenic factors, all could cause headaches. And there's do have some patients have a clear painful point in the head. And I do see there is, I can't say it's a lot, but there's quite a few very impressive cases I used to I remember in my mind is clearly triple warmer channel affected, and headache definitely is in triple warmer channels. By needling or use herbs, work on triple warmer can have very good results. So if you can, that's more to with acupuncture. If you more kind of found out palpating or examining different channels can give you a clue what's going on. And when we talk about the triple warmers, particularly when we're talking about the pathogenic factor, which is a heat-natured or warm-natured pathogenic factor attacking diseases, triple warmer always combined with problems of digestive and transportational system. For example, constipation, appetite being affected. So if that is the case, just by open the bowel or just use simple laxative herbs can clearly improve like headaches, like a sickness, like this kind of like so-called stomach bug, which seems, you do use nothing to do with head and whatever, but symptoms going very quickly. Why? It's because triple warmer is in charge whole body's general connections or performance, which is not one particular part issues, which is normally symptoms could be manifested to the key point or key exchange points of the triple warmer channels. So that is pretty important. So next time, if the patient comes to you, say, I have a headache, I have migraine, and I do strongly suggest you should palpating it, try to find out which channel in the migraine or headache is where the exact point is. And normally, you can find out very clearly which channels being affected. And then you either needling or use herbs regarding the particular organ or particular channels will give you much more focused treatment. Okay, maybe we have about 5 minutes break. And if I will be here, I don't go anywhere. So if you have any questions, you can ask.
The Dr. Chen, the triple warmer, following your the principles you were discussing about what the triple warmer does in terms of smooth transition. So it works with qi, of course, generally, and it also helps with the water metabolism, balancing the water metabolism.
Definitely.
Yeah.
Bowel, water, and that's what I mean. The transportation and the digestive systems, which is that's because the triple warmer it's almost like a triple warmer. I call them like a field of energy transforming, which is like they are cover much bigger. They're not necessarily in particular organ or particular part, but they will like a whole kind of energy transforming programs. Triple warmer have strong connections or general connections of it. So that's why I mean, particularly to do with the heat-damaged, heat-natured pathogenic factor attackings, the triple warmer always, in my personal experiences, is always to do with someone's water work not well, bowel not well, like burping, no appetite, or kind of those kind of things, which means they're on the top of the functional problems, there are also physical blockage or physical stagnations of pathogenic factors. So by cleansing internally, and then the problem will be gone. In fact, in my personal experience again, when I'm treating children's cold and flu, I normally very focused on the triple warmer more than anything else. Because my personal understanding is, because children normally have very strong immunity, very strong metabolism. They have very tremendous self-healing power. So normally, general cold and flu and whatever shouldn't cause them too much trouble if the triple warmer metabolism going smoothly. which is basically means if their positive qi and blood regeneration is going smoothly or being improved, and this kind of treatment is far better, give them like antibiotics, antivirus, antifungus to kill the pathogenic factors. So their body will sort out by, whatever the way they're doing it. And the triple wormer is the major organ or major channel who have the most contribution towards metabolism and towards the immunity. So that's what I normally used to treating children. But for the adults, on top of that, you need more things to help really fighting with the disease. You may need a cold expelling or and the heat clearance herbs. But for children, maybe you don't need anything like that. You just need to focus on their metabolism and their internal functions, and their body they have enough, or they have plenty of this kind of like T cells or lymph cells. They have enough, they can do it. And you just need to supporting those kind of place to function. That's
Dr. Chen, sorry. When you treat them, Dr. Chen, do you use one of the herbs? Do you use Lugen?
Not necessarily.
Okay.
That's what I mean. Lugen is a herb more to the pathogens. And for children, when we're dealing with triple wormer, we more towards our organ rather than to do with pathogen. Do you understand what I mean?
Yeah.
So just like, for example, if someone, if someone is physically very strong, if he's been beaten up by someone weaker, and then you just need to give this guy good food, good rest, and he will beat him up, no problem. He will defend himself easily. But if there's someone's really oldly like weak, and you can't only do that, you can maybe have to give him some weapons or to fight.
Yeah.
You understand what I mean? So the Lugen, this kind of herbs are like weapons. They are dealing with pathogens. And yet like Dangshen, Baizhu, Shanja, Maiya, Guya, and those kind of Ganzhao, those kind of herbs, Guizhi even, those kind of herbs, they are dealing with our own body, try to building up our system rather than against the pathogen.
Yeah, I've found some children when they have urinary problems. I've found, particularly very young ones, I found Lugen sometimes just as a single herb quite effective.
Yeah. Which is Lugen. It does help but normally for young children urinary infections, very often I use Liu Wei Di Huang or this kind of herbs, just completely nothing to do with the infection. But they also works. So which is, different approach. Of course, the difference between them depends on how long the problem is being going on and what situation is. So if the infection is recurring a lot, Lugen is kind of stuff maybe very limited. May help, but the problem will come back again easily.
Yeah.
Because if repetitive diseases, that means something wrong internally. More than the infections. Yeah. Okay, so we carry on with the next one. So stomach. So how do we know stomach being affected?
Should we have 5 minutes pause?
Okay, yeah. Well,
5 minutes break.
Okay, 5 minutes break. Just for that thing. Okay, 5 minutes break. Mm. Okay, maybe we can start. So we can start talking about stomach channels. How do we know stomach being affected? Obviously, if someone's starting vomiting, pains, aches, and stomach being affected. So that's quite easy, but straightforward. But there are also certain conditions. They may not showing the much diarrhea or vomiting yet. They just don't feel well. And we can still able to find out their stomach channel effect. That's what I want to talk about. And then firstly, headache, for example. Someone headache, if it's right in the stomach channel points, like the tollway, for example, they I don't know what's the stomach, how many number stomach is, I can't remember number, but you see they right inside of the corner of the hair. If those kind of points feel the pain, that is more like indicating stomach channels being affected. Again, the pulse and tongue, especially the tongue diagnosis, can help us a great deal. In my personal experience is some people, if tongue coating cover the tongue evenly, completely covered. Let's try to show you the picture. For example, like that, like the top of the picture. Actually, that's not really like that. For example, like this in the middle. This one, you can see the tongue coating completely covered. Like normally, I know everyone, we all have coat with the tongue. We have to have the coating, but normally because when we're eating, we're drinking water, whatever, we hardly see generally a ordinary person, or we can't say healthy, but the person who do not have the symptoms or do not have the noticeable diseases, patients, the tongue coating normally not covered like that. So if certainly some people come to you, the tongue coated completely. Not only my history record, normally I write down in fully covered. If that's the case, they're more likely stomach channels being affected. Why? Because if the coating fully covered, that means the damp is being completely covered the surface, and the vomit under the stomach channels in the respect of damp damage, stomach channels are front line. So in respect of the cold damage, the bladder or the taiyang is the frontier, and the front line, and the heat damage, a lung is front line, and with the damp damage, the stomach is front line. So that is so if it is even starting have vomiting, diarrhea, and so on, of course we know there is stomach damage, so which is quite easy to figure out. So like COVID, for example, during the COVID pandemic, and certain patients can have like loose stool, slightly losing appetite for a long time, for quite a while, for like a couple of weeks, sometimes for for even for a month. Even some patients say, oh, I don't, it's you know, I don't, you know, that's not a problem. I don't feel any problem because I've been for a month. I said, well, even for a month is not normal, you know, starting. So they don't think there's any infections going on. Actually, is infection going on, but just because our immune system able to quarantine the infections, limited in the stomach channels, not going up to the lungs, not being manifested to the high temperatures and the cough and so on. So they think they are themselves are fine. So that's why in the COVID pandemic, we know there's lots of so-called no symptom patients. Actually, in Chinese medicine, they are not no symptoms. They all have symptoms, but they're just not showing the symptoms we're focused on, which is upper respirational factors, which is lung. So that's why at the very beginning, the Xinguan, the COVID is being called the pneumonia. The new COVID, new virus, coronavirus causes pneumonia, but actually, it's not really a real, not a real effect of it. For instance, a very interesting thing you may be interested to know, when the Boris Johnson during the pandemic, when he wasn't well, well, I think he's working found positive or not, I can't remember anymore. But when he's talking about have a speech, the picture showed his tongue, showed his mouth. The tongue is so white. Even a small picture can noticeably his tongue is white. So we discussed private. So it looks like Boris Johnson get infected. But later on, he was infected and was in the, so the damp will show in that. So the headaches, the tongue coatings normally can help us to figure out in early stages of stomach attack. But of course, the diarrhea, vomiting, even the stomach pains, aches, it's all could be, not all could be, all clearly stomach channel damage. And also there is condition, that's what I mean. A particular, which is sometimes very strange. For instance, I used to treat someone, have issues, came to me. She's a therapist. She was an accountant, but she's also qualified. I can't remember which therapy. Quite a few years ago, she came to me for a problem of the aches and pains in the shin of her leg. So she's like here, like in this picture, like here. She's feel very painful, and so she did a lot of massage, did lots of things, and the same helps, but not able to stop it. And then someone recommended me, so I went to her house and we had a nice chat, and so she started talking about that, asked me what could be in Chinese medicine, and she wasn't prepared to use herbs. She wanted to use herbs. So I said, well, how's your bowel? Well, she said she has a bowel, loose bowel for years, for a while. Actually, it's not for years. Actually, finally, we found out for about 5-6 weeks, or 5-6 months. That was quite a long, quite a long time ago, maybe 5-6 years ago. So I said, well, for me, you have it's a stomach dampness caused it. Of course, her tongue showing that, her pulse showing that. She wasn't really, I don't know whether she's fully understanding or not, but finally, she was agreed to try some herbs. I just used the 藿香正气 plus few extra herbs like薏仁, like 败酱草, 干姜, and so on. And the symptoms of the pain in the shin stopped in about 2-3 days. She was really surprised. That's why we started talking about the Chinese medicine, thinking about what is going on with this. So which means what I want to see is even this kind of infections to the so-called external factor causing diseases, they could linger on for so long time. You cannot ignore it. You cannot think it's not external symptoms only because disease been going on for so well. That's what I mean. Lots of people say, oh, they have a cold. Oh, don't worry. I tested a month ago or a few days ago. It's not positive. I mean, I don't care the positive or negative. That doesn't bother me at all. But I mean, this kind of what I want to see, this kind of thinking is not quite correct in Chinese medicine of thinking. So again, I want to repeat, when we talk about external and internal symptoms, normally in Chinese medicine, we normally think external symptoms will always very quick, external, quick disappear, shorter distance, shorter durations of disease. But in England, I found it's not quite like that. Lots of patients who have MS, more like high percentage, I think I can't really give you a figure, maybe more than half, is to do with young channel being affected by cold. Patients who have ME, very high percentage, maybe half or even more, to do with damp or external damp even, attacking the body system, causing that. So really, that's why, I mean, the Shanghai Lun has been highly used and being highly respected. Although Shanghai Lun, this book only talking, well, Shanghai Lun's book really is talking about cold damage, external cold damage diseases, but actually can treat all internal issues as well. And that is because the conditions of internal issues caused by external pathogenic factor can drag on, can last long while and causing various conditions. And yet the formulas, which although is general originally was used to treating external pathogenic factors, also can successfully or effectively treating, maybe it doesn't sound like external pathogenic factor caused diseases. That's what I want to just try to highlight it. And that's what I just a moment I mentioned, but I here repeat again. The time and the post diagnosis can really help us if there's very complicated cases, conditions, to know are they external or internal. Generally talk in the time pictures. If the time picture showing the coated, for example, if they covered very evenly and completely covered, like even like the side of tongue is being covered, looks like just a moment the picture I showed you like that, they're more like the external. But if the internal, they could be uneven, they were patchy, or they have because if for internal issues, it's very unlikely will be complete cover of damp. I can't say it never happens, but very unlikely, very, very unlikely. I don't really see many at all. So that helps us to understand that. And another side is to do with the particular symptoms. For example, if someone started to feel cold, feel rather cold, and obviously it's external, the more like external pathogen caused. But if you're not certain, you are not sure. But when you see the tongue doesn't prove there is cold there. For example, the tongue looks pretty color reasonably red or whatever. So the more likely is external pathogen attack. It's because there's a cold damage to the body surface, the tongue maybe doesn't show immediately. So it takes time to be showing, because the tongue really is open up hot. It's a fire, it's flame, you see. So they're not quite easily to see such change or such a slight change. So if like that, that kind of cold more likely is caused by external pathogen rather than internal yang weakness. So if the internal yang weakness caused the cold or pain or whatever, so the tongue should not showing there is a heat or there's reasonable heat or reasonable yang energy. So that's also help us to understand that. Pulse, normally we believe, generally talk, external pathogenic factor cause disease, the pulse will be floating, because that means our engagement is in the surface. And yet internal pathogenic factor cause problem, normally it's less floating or not quite floating. But there is also extreme conditions. For example, in Shanghai Lun, so if the cold directly strike internal channels like Shaoyin, heart and kidney, obviously that's due to the immunity or due to our qi very weak, then the pulse will be hidden or will be sinking, but they also indicate there's external pathogenic factor caused there. So it's not an absolute, but generally talk, the pulse floating, it means there's external issues, otherwise less likely to external issues. And again, that's not only to do with itself, also the intention of the pulse. So for example, if someone were rather weak, if you know them well, the pulse always quite weak, and suddenly were noticeably floated, maybe not quite as floating as others, but they are floating, more floated than before, the more likely external pathogenic factor caused this. So in my, I think that's quite important alongside with the symptoms and analyze as well. Again, that's a different, all different pathogenic factors. The pulse could be different. That's wind, fire, the humidity, dampness, dryness, and cold. The pulse all showing differently. So if you have time, you can maybe look into it more. We just, it's a bit too complicated. So the first section I would like to introduce is cold attack syndromes. Cold attack syndrome, which is external cold pathogenic factor attacked caused diseases. So the symptoms I just repeat again: fever and chill, but normally more chill or completely chill, cold. That's what I just said. As we cared about, it's not absolute temperature. It doesn't matter for us. We more cared about the patient's feeling. If the patient feel cold, that is cold, regardless how high temperature is. So that is quite different in modern medicine, because that's what I try to always to tell the people, explain to my patient is, the machineries and all this kind of measurement, the modern science developed, invented, it's just try to generalize a standard to good for everyone. But in the world, there is a finalist machine God created, or if you don't believe God, where nature created, just try to monitor our self-feeling. That's our self-body. So, if you think about it, our body, how many sensors we have, how many nerve centers we have, so far more refined and detailed than any machinery can feel. So Chinese medicine choosing to believe the natural machine, our body sensors, rather than made from made by plastics or chips, whatever. So our body feel not well, feel cold, it's cold. If our body feel hot, it's hot. And of course, sometimes there is match, there's connections, but so the fever and chill or feel more chill is our body's sensation rather than the temperature tell you. During the COVID pandemic, I used to treat someone. She feel hot, she feel burning, but when she measured her body temperature, 35 degrees. And actually, in one stage, he even dropped to 34 point something. She feel really quite awful, really, really bad. So in that condition, in Chinese medicine, her condition is the yin insufficiency or the jing insufficiency caused they feel the heat. So in that condition, if we carry on use herbs to, because you feel hot, if you carry on use herbs to like a Lugen, like a Zhuru, to depleting the yang energy, that will be fatal to her. But we also can't use the modern medicine ideas, just try to, doing other things. For example, they once they want to give her oxygen, whatever, which does help her, but doesn't help symptoms at all. So with that condition, we have to, obviously on top of her tongue diagnosis and the pulse, that have no pulse, the tongue diagnosis, and nourish heavily of her yin and jing, which is some of the younger herbs in it, and symptoms improved very quickly. So that is, again, that's what I always try to last few years. I'm not means I'm trying to be against modern medicine, definitely not. Modern medicine have a great benefit to our society and so on. But one thing is when we're using herbs medicine, we have to use Chinese medicine way of thinking. Otherwise, we just don't know what we are doing really. So that's the one thing, fever and chill. Second, aches and pains we as mentioned, and also headache and stiff necks, wherever this all could be caused by external cold. Again, those kind of symptoms normally is the first stage, but later there could be cough, could be diarrhea, could be palpitation, could be like a very loose stools, could be high temperature, could be pneumonia, and so on. But the beginning, the early stages of that, these things will comes first, because there's a cold. The nature of cold will be like that. So to dealing with external cold, we give few formulas to help that. First one is Ma Huang Tang. I think Ma Huang Tang we learned before, so I will very briefly introduce this formula. Ma Huang Tang is the strongest. I put the three stars, 3 marks. It's the strongest herbal formula to dealing with external cold. In fact, Ma Huang Tang is probably, to dealing with external cold, Ma Huang Tang is the strongest formula in Chinese medicine so far. Again, unfortunately, in Britain, we can't use Ma Huang as the dosage we needed. So we can't really use Ma Huang Tang like what we use in China, for example, which is a bit shame. But luckily, because British unique calamity situations, I hardly, over the years, probably less than 10 cases, I need to use such a dosage of Ma Huang. Most of the time, like a Zishuye can replace Ma Huang, or even in particular condition, I think I told before, in particular situation, in certain conditions, I normally ask the patients use the herbal formula together with aspirins or with like paracetamol. Seems dealing with problem, generally okay. So which is one thing you can consider. Also, of course, this is not what I firstly used. This is in a more than 100 years time. The Zhang Xichun, he used this idea as well. The original words about Ma Huang Tang is treat Taiyang disease. Taiyang is blood channel. Always we believe is more likely to do with blood channel. So about Taiyang, in 6 channels in Shanghai Ren, we have lots of about this kind of Taiyang, Shaoyang, Yangming terms of that. The contents of this kind of terms, there's lots of debate. I don't want to go into it, but normally, generally, we believe Taiyang to do, or mainly to do with blood channels, because symptoms like headaches and body and the back pains or whatever, they are all blood channel get through. So less likely to do with small intestine channels. That's what normally we believe that. And headaches and stiff necks, for example, and have fever. Normally the fever can be very high, but in patient normally intolerant to cold, sometimes intolerant to wind, intolerant to cold. So patient can be very sensitive, which is very often when the patient feel like that, they can feel a draft more than normal. So the Ma Huang Tang suitable condition is no sweat. When the body feel hot, when the body have fever, physical fever, we can feel the fever, but no sweat. Of course, in modern medicine, that means our body's heat temperature adjustment system gets some problems, isn't it? In Chinese medicine interpretation, that means our skin surface, or our yang surface, or our body surface being strangled. So it's almost like an invisible layer of the membranes or the invisible layer of energy frozen of our yang energy. Because we know in Chinese medicine, sweat is the yang jiayu yin, which is the yang energy, work on the yin energy and then develop the steam, develop sweat. So therefore, if there is a yin energy exhaustion, if the water exhaustion, we can't have sweat. But if there is a yang energy exhaustion, we also can't have sweat. The difference between those two is if they are yin, the energy exhausted cause the sweat, you still can feel the hands, particularly the palms and the sole, feel a bit damp, or even feel a bit like a heat, or even feel a bit wet as well. But it's just not can evenly going to have sweat. But with cold damaged, cold strangled, no sweat. There are really no sweat. Everywhere is so dry. That's because the yang energy being completely packed in, being strangled inside, suffocated. So that is the thing. And then patient could have asthmatic breathing because that is also caused by the yang energy strangled lung no longer able to open and close properly. So which means our body, if we think of our body as a yang unit, the connections between our yang unit to external yang unit environment, like sun, like environmental air, being completely blocked, almost like being sealed inside. So if that is the case, that is most severe condition of the yang energy being blocked, or is most severe condition of external cold strangulation. Then we need to use sharp herbs to lift a strangulation and get the connections to the environment. So Ma Huang Tang is being used for that. Ma Huang we learned before, so it's internally it's red, externally it's greenish yellow or yellowish green color, which is can lift the fire towards the surface, which is towards the spleen, towards the liver, to stretching the yang energy to reach and to lift to get rid of the cold completely. And the internal fire or internal redness of the Ma Huang is where the yang energy came from. So that's why we use the Ma Huang to do that. So which like almost like a Ma Huang bring the fire into the inside, going outside. So if you see the seeds of Ma Huang, is outside, a fruit of Ma Huang is a red skin and internal black seeds. So it's all fire and water and fire relations. So basically Ma Huang is a great herb to communicate with the yin and the yang, to lift the internal heat to surface. That is what Ma Huang is so unique about. Of course, now the modern science found some chemical compound of Ma Huang able to is a great stimulator of heart and muscles and circulations. That's why nowadays even some drugs been developed based on the Ma Huang's major contents and so on. So it doesn't matter what we know, Ma Huang can get rid of the strangulation of the cold because of Ma Huang able to pump up or able to bring up the deep yang energy going to the surface and try to like cut open the strangulation of cold. But that's not enough. So we need something to support Ma Huang's function. Ma Huang alone able to work. So for example, like aspirins or paracetamols have similar effects. So with someone who have a pain, the headache, and no sweat, and if they take paracetamols and whatever ibuprofen, where it works, normally they have sweat, the symptoms reduced. But the trouble is, if their body is not strong enough, or if the symptoms not going completely, because some paracetamols or the aspirins, whatever, they only lift up, only open up, only generate the sweat, and do not have other support to, because, sorry, because what happens is when you're opening the door up to push the pathogenic factors out of the body, which is great, that's what we should to do. But also make the door open and make possibly more heat come into your body. So the modern medicine is basically use paracetamols and paracetamols or the aspirins or ibuprofen. They're doing such jobs, open the door, they push them out, but they leave to our immune system, leave to our bodies, ourselves, to fix the door, to repair it, and to get rid of the rest of the mess. That's why for someone who able generally quite fit and strong, so that's not a problem. They can deal with it. But for lots of other people who cannot deal with it, so the problem will be dragged on, although not as quite as bad as before, but they almost like they get rid of 80%, they keep 20% going on, and then they get rid of another 20%, they 80%, they have another 20% going on. They can drag it on and on and on. And with someone who have the chronic conditions of health, they will drag into other problems. They develop other problems. That's what modern medicine is problem. But in Chinese medicine, Ma Huang count the multi-components of formulas. Our formula able to have a team to just fix all of that mess. We not only use Ma Huang to lift the pores, open the pores to get rid of the cold. We also use Gui Zhi, which is warm, nourish, so promoting circulation curves to supporting Ma Huang's work. And also, we also know Gui Zhi able to adjust yin wei to keep the yin wei going, although we normally use Gui Zhi with Bai Shao together to do it. But Gui Zhi itself can promote and strengthen the heart energy. And the Gan Cao strengthening the heart and the spleen, because in the end of the day, our manifestations, our productions of the energy, other than from air, from the environmental air energy, they also manage from our food, from stomach, from water. So Gan Cao able to supporting the stomach, to supporting the stomach, to supporting the heart. Gui Zhi supporting the heart to supporting the Ma Huang to go into the skin surface to lift the pathogenic factor out of the system. You see, that's a whole channel, whole production line to supporting the issues. That's why I remember my father always said to me is the good Chinese medicine formula to treating cold or treating general diseases, the patient should not have aftermath mess to deal. For example, if someone have a cold, use aspirins or paracetamols, although the symptoms gone, but it takes a few days to recover. But the good herbal formula to treating the cold or whatever, gone is gone. They don't feel too bad. They don't feel need more time to recover. Like one symptom is gone, another symptom is later. They go together. Why? It's because we already make a complete consideration rather than symptom-based or single symptom-based method. So that's why, that's what I normally try to explain to the people. From a theory, Chinese medicine should not have any side effects at all, because we consider the whole needs of the condition rather than just one particular symptoms. So that is, from this formula, you can see the beauty of that. And also you see the dosage, 3, 2, 1. So that is the lethal, strongest formula we do it. So the strongest army in the front line, and then second line, and then later. So this percentage you can change. So if you found the internal weakness is major, you can do other ways. So from that, we also can see this formula from the Shanghai Lun saying, as soon as the sweat is developed, don't need to take any more. So if you boil, for example, you boil the 2 portions, if 1 portion after using it, 20 minutes later, sweat developed, and then the patient's symptoms gone, don't need to finish it. The rest of it, you just keep it, don't need to finish it. It's just also tell us this is not a formula for long-term use, because this formula really is not for building up the body, although there is some herbs building up the body. But this herb formula, main aim and target is to fighting, to battling with the battle rather than building up our body system. So that's the during the COVID pandemic, I have lots of patients ask me, say, because when they have really bad, have temperature, they're really scared, and the Remy ask us to take herbs. But during that time, there's lots of very long delays of posting and so on. So it's to panic. So because, oh, you know, because they've been advised, don't take paracetamol, don't take this. In the very beginning, so don't take this, don't take that. So I just feel I want to take something. I just don't feel I can just wait, do nothing. I said, well, you can take it. If you have it, you take it. Don't worry, but take it in 1 portion, 2 portions. If the sweat developed, you eat some, I even advise them to take some brown sugar with ginger to boil it with paracetamol. And some patients, interestingly, obviously, you know, we know COVID is some, you know, mild conditions. They completely recovered with just very simple home remedies. Also together with like paracetamol, whatever. It's a really similar idea like a Ma Huang Tang. So if they briefly use, just to open the door, just get rid of the major enemies of the cold, it's fine. But this formula should not long-term use. I mean, some people use it very regularly. Like I know some have back pains where we use every day almost. That's terribly wrong. That's terribly wrong because that's only, you know, they're not building up the body. They only can weaken the body, which is issues. That's why Ma Huang Tang is being used like that. And in Ma Huang Tang, there's also Xing'er being used. Why the Xing'er is being used in this formula is because when the Ma Huang Gui Zhi Gan Cao, there's a line we're dealing with cold damaged to the blood channels, which are on the back, and the yang channels. And because the symptoms also developed like asthmatic breathing, which means the lung also being strangled. So Ma Huang Xing'er Gan Cao, this line, Ma Huang Xing'er Gan Cao, is another line to dealing with a lung being strangled, because lung have two major function movement. We know easily. Lung is open when breathing in, and the lung is opening, then we're able to breathing in. Lungs like close, and we're able to breathe out without much effort. We're doing it, just like that's what you know, naturally we're doing that. So when the lung being strangled by cold, then it can't open and close properly. That's why asthmatic breathing happens. Asthmatic breathing with cough is different term, different issue. Later we'll talk about it. Asthmatic breathing, it means you can breathe in easily, you can still breathe in, but your movement be limited. Almost like before, you can move, for example, you can move, example, like 10 centimeters or 5 centimeters every movement, or 10 now you can only move 5, for example. That's why asthmatic breathing happens. It's not necessarily with cough. So that's what I mean. This cause of that is not caused by the lung itself. It's caused by the cold strangulation of surface of the yang energy. So that's why Ma Huang pungent character lifting, and the Xing'er bitter character, bitter flavor coming down. So one's help open, one's help down. That's what I said before. It's like rebuilding up the organ's natural function. And with Gan Cao together, to strengthen the earth to protecting the lung conditions get any worse. Because we know in Chinese medicine, the earth is mother of metal. So it's supporting it to stabilize the middle, to help, almost like, you know, you're moving you try to fix the things on the top of the table. You also keep the table stable. So that's what the Ma Huang Tang. So you understand also how the Ma Huang Tang is being constructed, and then we can find replacement of formulas to dealing with any condition you feel. For example, if you found some patient the aches and pain in the body, no sweat at all, you can ask them to use aspirins with a sweet, particular brown sugar or black sugar or red sugar with hot ginger, because brown sugar can deliberately, hot brown sugar can top up the blood, top up the heat. And with ginger can help the brown sugar lift up to transporting, going to the organs, digestive system, going to system quicker, and to minimize the damage of other aspirins or paracetamol. And also the brown sugar or ginger can settle the stomach to avoid possible side effects of the damage of as well. And the cold lifted or sweat induced without too much damage of the body fluid. So if it's a cough, we can maybe, if you don't have the Ma Huang and Xing'er, we can use, for example, ginger or split onions to open the pores, to open, help lungs to open. We can use like a water, like a mooli, like a carrot or mooli or and a turnip. This kind of a root, this kind of root, white, downwards nature of the herbs, of the vegetables, to help the lung to closing, or even honey to do such a thing. So we can use that to construct our formulas to help the issues. The acupuncture is the same as well. So if we can't using herbs, or you don't have herbs with you, then the cold is very strong. You can use moxibustion to treat 大椎、肺腧、风门 on the back of where the yang energy was important to our body, and the 风池风府 to heat them up, and then to get the yang energy through to the body. For mild conditions, normally it's good enough to work. And then if you found the patient do have the heart shoe points have issues, you can also moxibustion the heart shoe as well, to irrigating, to supporting the yang energy or heart energy, to strengthen, to support the manifestation of the body surface yang. So this is Ma Huang Tang.
Dr. Shen, just one question, please. Do you think the master put Ganjiao in there as well, because apart from treating earth, because the apricot seed is slightly toxic, and the licorice will counter the toxicity of the apricot seed? Or don't you think that was his consideration?
I don't think so. I don't think it's to do with that. I think it's to do with, because actually the apricot seeds because the ganjiao being used so many times, so many formulas, and the majority of the formulas doesn't have the apricot seeds. And in fact, for quite generally, the processed apricot kernel seeds or whatever, Xing'er, is not really, we're not really concerned of toxicity at all, unless it's a fresh.
Yeah, thank you.
Yeah.
Okay.
Yeah. And the second formula is also, we know, actually we've been mentioning this before, but I still use some time to talking about. That's because that's just more what I said. If we understand how this curve formula has been used, can give us lots of ideas, and it's very important. Guijitang is compared to the Ma Huang Tang is much more mild, because the symptoms compared to Ma Huang Tang, Guijitang symptoms have sweat. So therefore, the pores is open. So the cold is not able to strangle the yang energy completely. But why the pores is open, and that's because in Shanghai Lun, in the book of Shanghai Lun, saying the Ma Huang Tang is caused by the cold damage, and the Guijitang is caused by the wind damage. And the wind is a yang pathogen. Wind itself actually is a yang pathogen. And normally wind not go along to attacking body. So actually, Guijitang is damaged by the cold and the wind conditions. So that's why so the pulse is open. the cold is not that strong. But to be honest, in our clinical settings, the complete cold damage disease is easier to deal. And the mixture of the cold and with other pathogenic damage actually harder to deal. If damp with cold combined is very difficult. Wind and cold combined is difficult too. That is because the situation became more complicated, far more complicated, because the yang and wind is yang pathogen and cold is yin pathogen. And in the yin, we have to, instead of fighting with cold alone, we also have to fight with wind. But how do we fight wind? Because wind is so rapid, wind is so easily transformed. So we don't really need to do much because we can't block them, they're too fast. We don't need to push them out because they're too fast. As long as you have the door open, they will go out anyway. So we can't experience wind easily, or we don't need to experience wind to do that. But what we should do, we should rebuilding up our surface. So because when the wind starting cutting to our yin wave system and our yin has been impaired, the current condition is quickly we have to prepare the damage. And prepare damage as well as push the pathogen out. So we have to do in the same time. So one, almost like you fix a building or fix some kind of equipment, as well as using them to work, to live there. So that's why you have to do it very carefully, rather than just doing it one direction. So that's what the Guizhitang is, the beauty about it, because in the structure of the formulas compared to Ma Huangtang, Guizhitang is much more carefully used, and because of that reason, it's a much wider conditions we can consider use Guizhitang. So a lot of Chinese medical scholars believe Guizhitang is not a formula only for external conditions. It's for internal conditions more than for external conditions, which I do agree. I totally buy the idea. I do think for Guizhitang treating conditions, the internal conditions more to do with external conditions. Basically, just a moment what I said, like Ma Huangtang more like the weapon to dealing with the pathogens, and Guizhitang more likely like tonic to dealing our internal damage, our internal impairment. That's what Guizhitang, the major difference between the Guizhitang and the Ma Huangtang. So Guizhitang compared to Ma Huangtang can be relatively longer use without too much damage. And the Ma Huangtang, as long as the pathogenic factor or symptoms, major symptoms gone, you should consider to stop straight away rather than you take any more, because that can further weaken our system. But Guizhitang can establish our body system. The major symptoms or main concern of Guizhitang supposed to be used is sweating. There's a fever, there's intolerance of wind, combined with intolerance with wind and cold. There's bound up nose, there's nauseous or dry vomiting, like retching, those kind of things. And so I don't want to go into too much details because that will be gone too far, which is, if we understand the Shanghai Lunn system well, you can see the dry vomiting and the nauseous and the bound up nose, for example, they no longer external symptoms only. They're already going to pivot levels and internal levels of in the young ones. That is, we use Guizhitang to treat lots of conditions, like from the, that's what I mean. Like treat use MS, treat the chronic pains, with chronic fatigue, insomnia, and chronic infections, or even sometimes treating urine infections, depending on certain conditions. So therefore, Guizhitang have much wider coverage. So if we see the formula of Guizhitang, Guizhi and Baishao in equal weight, and I mentioned this before, such as very briefly, Guizhi can experience the pathogens, and yet Baishao can collecting or strengthening the body fluid. So it's almost like one push us from outside, one is pushing things from internal to outside, another is trying to push, come dragged in from outside to internal. So by these two can consolidating the surface defense. So if you understand what I mean, that's to do with rebuild up the yin-wei system. So when the yin-wei system had a problem, the number one symptom, that's what I just mentioned, is the patients feel uneased or feel odd, feel abnormal with their sense of the temperature of the environment. So that's what I use Guizhi mainly as a major concern I normally use. So from symptoms, the patient don't suddenly recently feel a bit cold, recently feel a bit draft, recently feel a bit unwell with the weather, I consider Guizhi straight away. So that is, I think this, if I say that this is more, for me, it's more solid facts than anything else. So for symptom-wise, it's because yin-wei being affected. Obviously, the reason could be varied, but the Guizhi I will be considered in my formula. And then the Gancao is strengthening Guizhi and the Baishao in the yang and the yin tonic. And the Shengjiang and the Dazao itself, like Guizhi and the Baishao. Shengjiang, Guizhi is pungent, and the Shengjiang is pungent. Dazao is sweet, and the Baishao is sweet. Well, Guizhi is sweet as well, but the Baishao is sweet as well. So Shengjiang and Dazao is two herbs, almost like a two easy get food-based of Guizhi Baishao. So that's why, if example, in particularly for Chinese family, most Chinese families have Shengjiang and Dazao in their kitchen every day of the year. I know for the British family, Shengjiang easy to get, Dazao hard to get, because Dazao have to be jujube dates rather than Arab dates. Different color, different texture, different. So what I use a Shengjiang plus brown sugar or black sugar or red sugar. That's what I use them as Shengjiang and Dazao. Although they're not quite the same, but they have similar effects. For the Wyans formula, use Guizhi Baishao with Shengjiang Dazao. Why don't they use double dose or stronger dose of Shengjiang Baishao and instead of the Shengjiang Dazao together? That's also because Shengjiang Dazao compared to Guizhi Baishao, they're food-based and they have a unique purpose, can strengthen the stomach as well as yin-wei. So there's also their unique contribution to the system as well. From the pulse wise, if you see the patient pulse floating, but not tight, not taut, Guizhi tongue consider, you can consider use Guizhi tongue. And for the tongue picture, if the patient tongue picture, the tongue is pretty soft, so they not full up, not looks like a very hard, then Guizhi tongue can be considered. Otherwise, if you see the patient tongue very full up, full edged, or looks very I'll show you a certain picture, maybe. You see, for example, like this kind of tongue picture, it's more full up. And you see this kind of, this kind of tongue picture also, you can see the texture, very harsh, very hard, then shouldn't consider use Guizhi tongue. But with this kind of a tongue picture, whereas soft, and then Guizhi tongue can be considered. So that is Guizhi tongue.
Dr. Chen, just one question on Guizhi Tang, please. If the person has, it's Tai Yang, you think it's Guizhi Tang, they're sweating, but in fact their temperature is quite high, not moderate or lower. Yeah, but they've got a higher temperature.
Yeah.
Can you add one herb to this formula to bring that temperature down? Say, add Huang Quin to this formula or something like that.
You can, but normally, if the sweating is there,
Yeah,
temperature normally is not very high.
yeah,
Yeah, because you see that's in modern medicine, if they can sweat, normally the temperature shouldn't be very high.
got it. Okay, but I
So
mean, sometimes I treat people when they have flu
Mhm.
and they have very heavy sweating.
Yeah.
And they got a high temperature, so you know they
If
do
like
that.
if like that, they could be very young natured.
Yeah,
If they're very young natured, Guizhi can't touch at all.
yeah,
In Chinese medicine, there is a famous saying they call the 桂枝下咽阳盛既毕. That means if a person have the excessive yang, if you take the 桂枝汤 formula, the patient will have a very bad, will be reaction very badly, very dangerous.
yeah.
Yeah.
yeah,
So that's why I mean the 桂枝汤 is warming up the herbs. So if
Yeah.
your tongue picture, for example, your tongue showing very red, lots of red dots, like prickly dots, and it's coated heavily or coated yellowish, 桂枝汤 you shouldn't touch at all. 桂枝 is a rather warm herb, shouldn't be used. But it's, so very interesting. I have to say it's very interesting because in Chinese culture, I don't know now maybe do as well, but at least in my knowledge, we don't use 桂枝 or we don't use 肉桂, we don't use cinnamon as much as English people, because I think maybe it's influenced by Middle East, or maybe because, like, for example, I do see some people drink coffee, so many cup of coffee every day, and most of the time take cinnamon powder with it. So that's a lot of heat in it. So of course, if there is a excessive yang condition, high temperature, sore throat, sweating, and this so on, and constipation, and that will be a problem.
Sorry, Dr. Chen, I can't hear what you're saying because there's background talking.
Okay. Yeah, I can't hear any background talking.
I don't know if anybody else can hear it, but I just hear, I think, Ollie and Elda.
Can you hear? Does anyone can hear?
I can't hear. I can't hear any backgrounds talking.
Is my voice clear?
Oh, sorry.
Yeah.
Okay.
Okay, don't worry.
Thank you, Dr. Chen.
Okay. Yeah. So we know in a severe condition, if there's cold condition comes, you use Ma Hong Tang, badly strangle. If it's not so bad, you use 桂枝汤. And then if there's much milder ones, you use 生苏饮. This formula we hasn't talked in our talk, but the formulas, the herbs we know, but we just not particularly highlighted talk. But this formula I used quite often is because Ma Hong we can't use, and really I have to say, for external cold, the completely suitable for 桂枝汤 conditions, not many. Most people in 桂枝汤 stage, they maybe don't consider themselves get cold or whatever. So they, I use 桂枝汤 more to treat people who have arthritis, have nerves pains, have those kind of problems, rather than have to come to looking for cold treatment. But 生苏饮 I use a lot. 生苏饮 to treat cold attack, fever, and headache, and or combined with phlegm and fluid stagnation. That is really a lot of the conditions like that. And I treat all kinds of body fever, especially in Britain. Over the years I'm working in Britain, I found that most of the patients come to us is they already in this stage. Why? Because firstly, when they have a cold, for example, headaches and whatever, they normally don't, maybe they don't, most of them don't see any doctors. They're in the kitchen, all every kitchens, they have paracetamols and those kind of ibuprofens. They already take it or take it in quite a few days. And until their stomach being badly damaged. Also because in Britain, when the people have a cold and such thing like that, they very often, when they have fever, they always often will drinking cold stuff, even use ice, put on their forehead and the body and so on, try to cooling down their body temperature. And all those things, firstly, weakened the immune system, weaken their yang qi system, and develop the damp. So the damp stagnation or fluid stagnation or even phlegm stagnation already very noticeable by the wrong, this is not very correct treatment. Also, their cold pathogens already been deteriorated, so they're no longer that much cold. But the symptoms from external symptoms already tend to half of the external or 20% external, 30% external, 70, 60% of internal diseases. So that's why for this kind of problem, when we're dealing with, we no longer need a Ma Huang Tang. We're no longer suitable for Gui Zhi Tang, but they are suitable for Shen Su Ye. Why? And because this formula you can see, we use Mu Xiang, we use Zi Su Ye, if maybe you can't remember the formula name because this name is not very easy to remember, but you can, if you give you a very brief thing, is basically 2 lines. One group of herbs try to dealing with mild, relatively mild external cold pathogenic factors. Another group of herbs is to do with internal damp stagnation or internal fluid phlegm or internal malfunction of transportational or digestive system issues. That's the 2 major channels, major lines. And I have to say in Britain over the years, majority of the patients come to me for cold symptoms is like such condition. That's just one that I repeat this. Partly is to do with the wrong treatment, partly to do with the environmental issue as well, because Britain really very unlikely to have a very strong cold, but there's plenty of damp available, and because lifestyle and so on, so they develop lots of issues. So Zi Su Ye or Su, Zi Su Ye, that's the formula. The yin, it means decoction, and the Su is Zi Su Ye. Itself is a great herbs. I normally use it to replace Ma Huang, or to instead of Ma Huang, to treating external cold strangulation or external cold attacking. But compared to Ma Huang, of course, Zi Su Ye is much more weaker, much more milder. And I think you all know, because you already learned Zi Su Ye before. You see, compared to Ma Huang internally is a red powder, it's concentrated. It looks quite solid actually. And they don't have much leaf at all. It's just the sticks. We only use the sticks. So it's almost like they're like a concentrated capsule. Their energy is all being impacted in a small sticks inside of powder. You see, so they're like a much more stronger stuff. But if you see Zi Su Ye, if you go into the Vietnamese restaurant, you can see they use Zi Su Ye as a part of the spice. They are very fluffy, actually when they dry, they're very thin, very fragile, very crispy leaf. It doesn't have much, so the energy already even spread out. And the color, purple color, similar with like Ma Huang red color, they go into the blood channel as well. So they do kind of warm up the heat, warm up the blood, because the leaf, they open the leaf, so they go into the lungs, go into the skin surface. So they do kind of lift energy out of the push the cold energy out of body. But compared to Ma Huang, it's a far more weaker. So if you understand that, it's fine. But not only that, the difference about Zi Sui is if you smell, Su itself means fragrant or nice smell. It means Su. So Zi Sui is a very fragrant, pleasant smell. And yet, this kind of aromatic, fragrant smell is able to resolve or expel the dampness. That's why Zi Sui is able to resolve the damp and get rid of the cold. So that's what Zi Sui is good at. That's why I put the tongue pictures of this patient. You can see in such condition, there is no heat here. You can see from the tongue picture, there's no heat there. So therefore, we know, that is definitely, at least from that tongue picture, you can see, it doesn't matter what symptoms the patient do have cold or cold-related problems. And you also see the tongue coated evenly or quite evenly. So it means the damp is stagnated. And also, of course, as you can see also the tongue pictures, the surface of tongues are even a bit bumpy. So there is stagnation of fluid, stagnation of phlegm, and all those kind of conditions. So to treat such condition, we have to use herbs like Zi Sui to expel the external cold, also help resolve dampness. And to help Zi Sui to do such a thing, we can use Ge to, we can use the Ge, which is a kind of, Gange is kind of Ge to help push out, lift up the energy from the middle warmer, from the middle warmer to the body surface. So it's two things to help pushing up the stuff out. And yet other bigger team like a木香、半夏、茯苓、枳壳、桔梗、甘草、陈皮、生姜, all those herbs can resolve the damp. So I just quickly repeat. 木香 we know is a herb to activating the qi stagnation of our body. 木香 do not have any functions to expelling pathogenic cold or whatever. But 木香 able to have aromatic nature to activating digestive system to make the earth going. Because mu is wood, xiang is fragrant. So it's very woody, fragrant grass root. So they're able to get the stagnated earth going. And the 半夏 to resolve phlegm. 人参 strengthening the stomach. 茯苓 strengthening the stomach, activating the stomach, also drain the fluid. 枳壳 help the 木香, but they are very similar effects. But the 枳壳 able to go into upper to from the 三焦 triple warmer, keep the triple warmer going. And the 桔梗 also lifts the energy up, resolve the phlegm, remove the fluid. 甘草 help 人参 and 陈皮 to activate the stomach. You see, 人参、茯苓、甘草、陈皮、半夏. This is 二陈. Do you remember? 甘草、陈皮、茯苓、半夏. This is so-called 二陈 formula. Resolve the damp. And 人参、茯苓、陈皮, 人参、茯苓、甘草. This is so-called 四君子 without 白术. And 半夏、陈皮、茯苓、甘草、人参. This is so-called 益功散, which is 4 qi tonic herbs plus 2 phlegm reduced herbs. So which means all the major team is to do with building up the digestive system to settle the internal digestive and transportational system to help the triple burner, triple warmer to keep the supportive team of our body to fighting with external pathogens. So that's why, as what I mentioned, over the years I work in Britain, I use this kind of formula far more than other formulas, because when the patient come to me, 80–90% of them are really over the stage of severe conditions. Like for example, the aches and pains are already gone, the high temperatures are already reduced. They're no longer 39, 40, they may be 38, 37 something. They're not normal, but they're not quite as bad because they're already been maybe a couple of boxes of paracetamol already being consumed. So that is a major problem. They come to us. So with this kind of people, we really is 80% of our effort is to dealing with the mess after they've been wrongly treated. And so this formula I've been used far more than any other formulas. And the 生姜 and the 大枣 is exactly like what 桂枝汤 we mentioned before, like a 桂枝 and 白芍, but in a much more mild form and without creating too much heat inside. Because with damp, we don't want too much heat inside being created. We want the heat going into the system and going out. So like 紫苏叶, like going to the surface, floating in the top rather than sinking inside, because that will causing damp heat, and we don't want to see that. There's one herb I mentioned the words to mention is a 前胡. You see that 前胡. 前胡 is a herb we haven't talked much in the herbal course, but 前胡I use quite a lot is to treating if there is a cough with a phlegm. So your patient have lots of cough and have phlegm, 前胡can be considered. So if there is a phlegm and the fluid stagnation considerably noticeable, you can ask patients, oh, do you cough up? So, oh, what's the cough like? If they say, oh, they're quite lumpy, quite sticky, 前胡is good herb to consider. 前胡桔梗甘草 is great to do that. With sore throat, 桔梗甘草 is perfect for that kind of condition. So this formula can dealing with most of the flu or cold conditions. And also because this formula, the expelling cold herbs not that strong. So therefore, even someone's cold symptoms caused by the mild heat strike, cause a sore throat, cause cough, this formula also can be used and can have some good result as well. Although this not this formula be designed, because this formula designed to treat cold attack. So a heat attack, we have like just a moment being mentioned, like芦根 and where we can use that as well, 芦根、竹茹、连翘等等 and so on. But even you don't know that, this can be considered. So I think I do hope you can remember this formula. And if you in the future, if you see the patients have the conditions like that, particularly have the time period like that, you definitely can use this formula to use, can highly likely will get some results from it. Some can be very quick, if not so precise, maybe not so strong. And the dosage of these kind of formulas, you can adjust by yourself. For example, if the patients have strong symptoms, feel like cold and a bit shivering, you can use a higher dose or percentage of 紫苏叶. And if someone have very stiff neck, like a headache, wherever, you can use a higher dose of 葛根, 干葛. 干葛 is dried 葛根, it's the same thing. Can consider if someone cough very strong, consider 前胡 can be increased dosage. If you have sore throat, 荆芥 and 甘草 can be have a stronger dosage. So if someone have like a retching, diarrhea, loose stool, 木香, 枳壳 can be higher dose. So that is 生苏饮. Myself, in my place, I already mix up 生苏饮 as one of my cold formulas in my place. So when I have about 3, sometimes 4 kind of cold, ready-made cold remedies, ready-made, leave on side, put on side. So patient come in, I can quickly, when I see the tongue picture, then I can quickly give them a formula to use, and that they don't need much normally. It can quite quickly to have the results. And this formula also very good for stomach bug, like norovirus, whatever, can work really well. But if the tongue coating is thicker, more white, more thicker, you can also put 藿香 and 香附 together to make this formula stronger. Okay, so this is 生苏饮. So we have about another 5 minutes break. Okay. Does anybody have any questions about this formula? If not, we carry on. Please do this, you know, if you any, please do talk if you have any questions or any concerns or any opinions. We can, you know, I can understand what is, you know, any you know, hesitations or any problems, and we can correct them immediately. Okay. So the next formula also is very common use formula. I mentioned this formula we learned, and I use this formula a lot as well. But because this formula is a very small formula, so very likely I use them inside of the other formulas together with other formulas to help in the issues, and especially for preventing issues. Because this formula was originally used to treat all seasons epidemic and cold attacking diseases. And by the history book recorded a few times, this formula has been used in greater epidemic to preventing epidemics. So during the COVID pandemic this time, I use this formula. If anybody asks me to advise some formula to take regardless of the body, regardless of the body conditions, basically, I normally give this formula to them. It's because from a theory of Chinese medicine, this formula is pretty good. Why? Why is the formula pretty good? It's because in my understanding, to generally preventing the infections or pandemics, we need normally achieve from two directions. One direction is try to harmonize with the environment. I call it 外和六气, which means externally harmonizing or try to harmonizing with seasonal weather changes. For example, like in the cold, in the winter, you try to put more clothes. In the summer, you try to take less clothes. In the autumn, you maybe try to, in the spring, try to drink more water because it's dry. In the summer, you try to avoid too much heat and so on. We call it 外和六气. And internally, or in ourselves, we have to adjust ourselves qi transforming functions are called 内和五脏 to help our organ function properly. But by doing that, of course, can we have various issues, various herbs to do it. But this formula, the two major herbs just able to do such a thing. It's because in the formula, two major herbs, 香附 and 紫苏叶. Just a moment I said, 紫苏叶, that's what 香苏上面. 紫苏叶 is a herb like 麻黄, but in a much milder form, much milder version to expelling the external cold. And unlike 麻黄is only good for the cold. But 紫苏叶, maybe 麻黄 can help with wind as well, but mainly to with cold. But 紫苏叶 not only for the cold, also good for the damp, because 紫苏叶 such a fragrant nature, and also 紫苏叶 so mild, so also able to dealing with maybe a bit of heat stagnated. So any like a small dust or small unlike the pathogenic factor skin reach on skin surface, 紫苏叶 all can generally repelling, expelling them. So that's what the good of 紫苏叶 is about. So milder, but because of milder, so it's much wider use. That's why 紫苏叶 able to help us to externally harmonizing or dealing with various conditions of seasonal pathogenic factors. That's why 紫苏叶 is good. And also 紫苏叶 in our food chain, not in Chinese food chain, but mainly like, well, sorry, I can't say that, not in northern Chinese food chain, I should say that. In southern China, and like Vietnam, in a Southeast Asia, like Thailand, Vietnam, Laos, Indonesia, apparently in their cuisines, in their everyday cooking, 紫苏叶 is one of the common spice, like coriander, like spring onions in their food chain. So if they're in their food chain, that is also means these herbs is much milder. They're not quite so, so lethal. So it's able to be consumed or taken for a long time without too much concerns. So for example, the ma huang is great, but you can't take ma huang every day, because ma huang is too powerful, too strong, and even gui zhi shouldn't be used every day as well, because they are quite warm, quite strong, quite functionally quite clear function. So therefore, they have two strong characters, but Zisuye much bolder visions. So at least good for wind, cold, and slightly heat, and that is major pandemics caused by. And the particular damp, in Chinese medicine, generally believe that damp is one of the major elements, either single-handedly or involved with other pathogenic factors causing very fast pandemics, particularly in the last few hundred years. Which there's a scholar in China I know quite well. He studied the history of history of astrology and climate change. He talks like in the terms of 1,000 years or something like that. Although it's limited information, but by doing that, and he's every few hundred years by the Chinese medical book, Chinese mysterious book like Huangji Jingshi, will be one element in charge. So the last few hundred years, damp causing this is pretty dominating. Maybe in the Han Dynasty time, 2,000 years ago, cold is made a more outstanding elements, but later heat and damp, and every so often there is major pathogenic factors change. So that's why Zisuye is great in such condition to help us externally harmonizing with it. And how do we internally settle our organs? Of course, we know our organs is 5 organs or different elements. We can't just use one element, treat one organ to deal with them. But there's a unique organ or unique system can generally help all of organs, which is triple warmer or triple burner. And xiangfu is just such herb. Xiangfu is black color. Xiang actually have a unique fragrance. And also xiangfu able to go into the liver, and the liver is a major organ, or liver and gallbladder, the wood, able to transporting or support strengthening all the from the bottom to the top, because we know the wood is from grass, from the ground, and they going up, reach to the fire. So that's why our energy, in our body, liver is communicating with the kidney, which is supposed to be the water, lower part of the body, and then right through to the heart, because water gives birth to the wood, wood gives birth to the heart, to the fire, which is kidney communicating with low to top. And xiangfu just able to such thing. So xiangfu itself able to stimulate or strengthen the triple burners qi transforming program, particularly in the term of lifting up rather than sending down. So you see, there's 2 herbs. One is able to experience cold and damp, but able to have much cover other pathogenic factors as well. Another herb able to lift the energy and all the triple burners energy, generally talk, to reach to the body surface, to reach to the top part of the body, to help the manifestation of the internal energy to the body surface. So which is one like a strong team fighting with the universal issues of the external. And another is able to settle and promoting internal resources to settle all the miscellaneous imbalance and supporting the frontline needs. So this formula able to cover much wider range of seasonal pandemics. And so that is this formula is good at it. But of course, depends on what condition. If it's very severe pain, cold damage, then that's not enough. For severe heat damage, that's not good enough either. But for generally not so severe conditions, it's good. Particularly if the patient's symptoms showing the triple burner stagnation or general weakness of immunity, this formula is really good. And also xiangfu, this herbs able to adjust gynecological stagnation of the issues. So I use this formula to treat the young, for example, like some, last episode we're talking about the last modules we talk about gynecological issues. We use 小柴胡汤 and so on to treating during the infections and the patient have period, or during the period they had infections caused issues with emotional change and other blood disturbance of that. You can use 小柴胡汤, but 香苏散 also very good formula as well. So I also use this to emotionally feel down in the after childbirth, after postnatal down, like those kind of conditions. 香附 and 苏叶 actually works really well. That's because I consider this formula to adjust triple warmer or triple burners condition. Another two herb, 甘草 and 陈皮, although they are much mild dosage compared to the 香附 and the 紫苏叶, but they also have a unique purpose. It's because all those kind of things, either lifting up or fighting side, you always need a stable middle, which is digestive system and middle warmer stable. And the 甘草 陈皮 just can't do that, because 甘草 we can equivalent 甘草 with the 四君子汤 for 四君子, which is basically strengthen stomach qi and settle down the middle warmer, strengthen the earth. And 陈皮 help the qi, activating the qi, stimulate the qi, remove stagnates. So two herbs have like a settled middle. So without these two herbs and 香附 and 紫苏, too much yang, too much going out. So long-term use can maybe make internally weak. But with these two herbs to settle down the middle, to activating the internal digestive system, and then can help the formula much more balanced and less worry about in the backyard. But if the patient, for example, have a clear weak issues, for example, someone have chronic diarrhea, like I treat a young boy, only about 11 years old, going to the toilet 4 or 5 times a day. Every time after eats anything, have to go. And eating very, very slowly and very skinny and very thin. If like that, the qi weakness pretty outstanding, then you can consider put the dangshen and fully together to make this formula even more capable to dealing with such condition. So this can be changeable. So that's what I mean. Compared to 生苏饮, I normally use 香苏散 alongside with other formula to dealing with complicated conditions, unless it's only for general protections. Because during the COVID pandemic, there is a big demand of everyday use. There's quite a big market. Someone created some tea or whatever, but I have to say, they all have issues. They can see if they're good at one A thing, they're not good at B thing. So therefore, none of them can cover yin and yang, can cover because everyone's body character different. If someone generally have a yang excessive in their body character, then the suitable formula not able to help someone who have a yin excessive body characters. But the 香苏散 is one formula among all of them, is far more universally suitable for most of the conditions. So that is what the 香苏散 good at. And 紫苏叶, 甘草, 陈皮, those all three in our food chain, or mainly in our food chain. But 香附 is not. But 香附 also considered quite mild herbs as well. So relatively talk, they can consider to be long-term use. And this formula in the future, if there's, for example, I also, someone came to me, he's every year he liked to trekking into the mountains. And the last time he was trekking in the, can't remember which country, South America country, 6 weeks, he was 4 weeks in the hospital, was really disappointed because he wasn't well at all. So I think last year he was thinking about to trekking again. His recovery is really that's one of his most fun and social thing as well. He really enjoyed it. So before he go, he asked me to do something to help him to cope with that. I gave him the xiangsu yin, a slightly twisted xiangsu san to take with to preventing. So last year he was good. Yeah, he was okay. Of course, I can't say it's just because that, but you see about this kind of things, able to do such a thing. I can't give him Ma Huang Tang to go with it. And so that is difference. Is there any questions? Otherwise we carry on. So another quite a mild
One question.
Yeah.
The recipe xiangsu.
Yeah.
And how fast do you expect an response of the herbs?
You mean for the treating the problems or for the
Treating problems, as you have been talking about, not to treat the epidemic part, but the stagnation of Sanjiao.
So all the formulas, if we use correctly for external pandemic seasonal diseases, we all should expecting some kind of a change or some kind of relief within the matters of hours or at least a couple of days.
Yeah.
If we use correctly. I mean, so normally my advice to the people ask, oh, how soon I should expect the result? I normally tell them, should be not more than 3-4 days, which is because in certain condition, because dosage maybe will not be enough. Like for example, very recently I treated someone before I left China, and he had indigestion problems. He eating wrong food, and then after he had the food toxins, food poisons, and afterwards he for quite a while, for about weeks, he feels not right. He no appetite at all, and anytime he eat a bit more, he feel bloated. So after about 4 or 5 months, he came to me. So he asked me, give him I said, well, you take that. I said, you should expect him about 3 or 4 days change. But I treated him the whole family anyway, so he do trust me. But after about a month later or so, he came back to me and he says he's better, but still not good. I said, well, okay. I said, oh, if you like that, I said, you need more herbs. I said, no, I just finished your herb. I said, oh, the herbs I gave to him only enough for take a week or so. And then I realized there's misunderstanding because I tell him to take 3 spoons 2 times a day. Actually, he take the 1 spoon a day. I don't know why. Maybe because I treating his children. His child, one of his daughter is take the 1 spoon a day. It's because her daughter actually is about 4 or 5 years old, but it's just for generally to preventing the eczema. So I don't need much. Maybe he forgot the dosage I told to him. So that's why. That is, I think that I thought that time I told maybe it's because of that reason. So I give him a bit more. I said, well, you take this full dose again, and if not, you let me know. But since then I never heard anything. I assume the dosage helped. So that's what I mean is, so if you want to give in a certain condition, if you're not 100% sure, certain, normally I will ask them to give me a rain after take a day or so, or 2 days later. Because normally in my expectation, they should have the results straight away. And I have to say, most of the time, patients are able to feel the cold and the flu is constant. They will say, oh, immediately I feel better. or sometimes 5 minutes or 10 minutes feel better, which is almost like psychic. It's not really, you can't even believe it's caused by herbs. So it should be that quick if the dosage is strong. Otherwise, we have to consider is the right direction or not.
But if you have a lady after delivery, for example, and the stagnation of the Sanjiao is rather big, I don't think you can expect. She's weak. I don't think you can expect effect.
You also can expect relief quickly. I mean, not to get rid of it. You can expect the relief quickly. If so, for the women to after the like postnatal, after labor straight away, that's what the last module we talked about. You need tonic. You need some tonic. As long as you see, that's the thing. As long as we use I mean, it's not means I can. It's not means I always can. I mean, it's definitely not. But as long as we make it more properly or correctly, we really should expect some results straight away. Like for example, this time I come back, actually in China, I'm quite busy as well. Actually, I don't really have much rest. Like I treat someone, she has stomachache badly. I treated him for quite a few years ago. He also do the herbal pharmaceutical. He does the medicine as well, and so I treated her stomach, and then the couple of days later, because we are quite good friends, I know her for so many years. So a couple of days later, I just messaged her. I said, "Oh, how is going on?" She said, "Oh, it's always like that." She says, "Let's just 20 minutes. I feel the relief," or something like that. So that is really the herbs, how quick the herbs can be, or we want it to be. They can be like that quick. So I remember that's my father told me a long time ago, said, if it's not not see some improvement quickly, you have to consider it's the right direction or not. Because the herbs, if quick, that's what I mean. To see some change should be relatively quick. The maximum 3-4 days. If the 3-4 days still nothing happens, then we should consider something. Again, another condition is there may changed, but the patient don't realize changed. So if you ask more details, actually there is change.
Thank you.
Thank you. Okay, so we carry on with there is another formula to treat external cold in a relatively mild version. Actually, this is stronger than Xiangsu Yin. This stronger than Xiangsu Yin. This stronger than Shen Su Yin, but it's still mild version. Actually, I can't really. The stars I'm giving is not quite. We shouldn't take it in a very religious way. But just give you a simple indicator. To treat cold attack and other seasonal diseases, fever and headaches, aches and pains in the body, combined with cough, blocked nose, dizziness, vomiting, retching, etc. You see, this all sounds very familiar, isn't it? Like what we mentioned, like in Shen Su Yin, like the Ma Hong Tan and so on. So that's basically have some kind of cold damage, also have some kind of stagnation internally, and so on. But the difference with this, with other thing is the patient's condition is being prolonged so long and the patient is a bit weak. So that's why we use Ren Shen to help. So if you see the name, you know this formula is treating for internal weakness related external pathogenic factor attacking. They call it 人参败毒散. 败毒means get rid of toxins. 毒 is toxic. 败 is get rid of it or defeat the toxins formula. So in this formula, you can see inside has been used chai hu to expelling the cold and heat as well. Actually, Chaihu is cool character, but Chaihu have very strong pungency nature. So Chaihu able to expel either cold or heat. Also the Qianghuo and Duhuo. Do you remember? Qianghuo and Duhuo is two herbs we used to expelling the cold and the damp. So from these three herbs, we can understand this formula is particularly good to treat cold and damp blocked the Taiyang channel and the Shaoyang channel. When the Taiyang and the Shaoyang channel blocked, the patient will feel heavy, stagnated, and they like a sinus. The patients will feel very heavily, like what are the English words, like a full head, like they come out from swimming, like they come from out swimming. The whole head, forehead feel heavy, feel bunged up, feel very unclear. And they don't really necessarily feel lots of cold. They may feel a bit cold, but the main things feel heaviness, muddiness, and aches and pains on the back and the neck, but they're not as bad as Ma Huang Tang or Ge Gen Tang. So with this, the tongue picture should be showing coating as well, because there's damp involved. In fact, in Britain and in southern part of China, particularly in the winter, is a very common situation, which is damp and cold combined attacking. In the this time pandemic COVID, this formula has been used by few provinces of China, recommended government recommended formulas, and had a very good result. And that's because the Qianghuo and Duhuo, the unique purpose is a bit more stronger than Zisuye to get rid of the damp, and not quite as Ma Huang, just get it cold. So with the cold damp combined formulas, it's very good. And with Renshen, Fuling, Chuanxun, Gancao, those herbs also nourish the qi and blood. We know Chuanxun can strengthen the blood circulation. Fuling and Renshen can nourish the qi. So those herbs internally supporting the qi and the blood, externally expelling the damp and the cold. Also use the qianhu. You may be confused with baiqian and qianhu, but baiqian and qianhu are different herbs, but they all have similar effects. The herbs really good for cough. So if the patient have a cough, bunged up nose, a lung being not able to open up properly, qianhu is good for that. And the zhiqiao, you see, 桔梗, zhiqiao, qianhu can able to adjust chest, lung, stomach, intestine, the qi active, qi transformation, qi transporting. So therefore, this can help somehow resolve or promoting the triple burner stagnation. Later, I will talk more. We know, I think I repeat again, we know the cold damage. If the cold pathogens will first directly attack young, we already know that, isn't it? We also know if the heat damage will affect the yin. What damp will affect? Damp will affect qi transforming. And the qi transforming most directly connected to it is middle wormer, and really it's triple wormer. So therefore, if we're dealing with triple wormer, if we're dealing with damp damage, we should always consider triple wormer. Of course, sometimes patient symptoms may be only in the middle wormer, which means like stomach pain or vomiting, retching, but it also could be upper wormer, like a nauseous, sickness, and also could be lower burner, gas for sticky stools, bloated stomach. So very often we know by modern science, there's upper middle wormer, actually they are kind of the same line, they connect to each other. Any part of the block will affect others. So that's why we always, later we talk about Huoxiang Zhengqi, exactly the same. we always use herbs, try to put herbs for the upper, for the middle, and for the lower, and for whole 3 burners functions. So this is what basically ancient Baidu San is about. But compared to Xiangsu San, stronger. Xiangsu San, we talk about Xiangfu able to do the triple burner, but Xiangfu itself cannot, the strength of Xiangsu itself cannot compare to with Jiegeng, with Zhiqiao, with this kind of few herbs work together. For expedient purpose, the Zisuye cannot, not as strong as the Qianghuo, Duhuo, Chaihuo together, isn't it? And also for the cough, it doesn't have cough, but this one have cough for the Qianghu for the cough, and for the weakness of stomach, although there is a Ganzao, here have Ganzao as well, and for the sore throat, Jiegeng Ganzao together. So you can see there's few more herbs combined. And on top of that, this formula also uses 2 extra herbs to bond together, which is ginger, shengjiang, and bohe. Bohe is a great herb to expedient the external cold. So therefore, this formula, again, like Xiangsu San, like Xiangsu San, is able to dealing with cold, also able to deal with hot, warm as well. Hot maybe too much, but with a bit of heat, it's also able to do that as well. Because inside the herbs, because you see, in Chinese medicine, we have a saying, we say, oh, some doctors really not good. They can't even distinguish the yin and yang, can't even distinguish the internal, or, this blah, blah, blah. To be honest, in lots of conditions, not that easy. It's not that clear, or maybe it takes ages to find out what it is. It's not always easy, even for someone experienced, very experienced. And for certain mild conditions. And in fact, that's why in my place, I have lots of ready-made, like a Jinshen Baidu is another formula. I have about 4, normally it's 3, but can be 4 kind of ready-made formulas for cold for various conditions. And so normally I can make it, it's just like a OTC buying. I can just say their tongue, 2 seconds, and I can decide which ones can be, because normally they're youngish, they looks healthy, they generally, not complicated cases. We don't really need, we maybe don't have enough time to find out. They don't have much money. They don't want to spend too much money on it. But we still can help them. So we are even, we can get something for them, maybe, almost as cheap as paracetamol or like that, but it's far more effective. Over the years, I have to say, my cold remedy is quite well known around the people that regularly came to see me. So they, in their kitchens, always have some cold remedies stuck in their shelf, and if they don't feel well, they don't need, or they're not able to tell they're cold or heat, but they can do it straight away. And have to say, they feel very beneficial. That is because if you want to use something to treat such a condition, you can only use this kind of formula to do it with milder cold and heat natures. Otherwise, you have to, for example, you can't just give Mahuano to everyone. I know the England law regulation not allowed, even though allowed, you can't do that. There won't be a proper, you will not, if you're doing that, you can't sleep properly. You can't sleep peacefully because you do worry, have other consequences. But Jinshen Baidu San, Xiangsu San, this kind of formulas are relatively milder and a much wider range of applications. So that is the cold damaged cases we already talked. And I do hope you have a good look into the these few formulas. I have to say, 90% plus my patients I'm dealing with every day with if they are cold caused problems, this few formulas is enough. It's enough for us to use with cold combined with damp, with strong cold strangulation, with cold damage often caused by chronic weakness, chronic motor weakness, pains, and so on. All those few formulas are covered, almost covered. Yeah. So there is a case study I just talk about. This you can't believe. There's a 3 tongue pictures. This tongue picture. I just want to show you the cold, damp, and the cold combined with damp. The tongue conditions can be so varied and can be so changeable with the treatment. The tongue pictures can be changed so dramatically. You can't even believe they are the same person's tongue. Oh, but of course, the particularly these 2 tongue, the person, particularly how relaxed the tongue picture being taken, make a massive difference. But I want to say is, from that you can expect from immediate and very quick. Normally, for example, like from this tongue picture to that tongue picture, in between is only a few days. You can see the tongue picture changed, the texture changed, the coating changed. So, for example, if we see the tongue picture patient like that, had cold, had the flu, because I have I have tens of thousands of tongue pictures during the COVID pandemic. Obviously, some people, I have some people maybe have 20, 30, maybe not 30, maybe about 10, 20 pictures for one person from the beginning to the end, during between the consultations. So you can see, interesting to see the picture changes. So that's why I mean, with the conditions change, with the herbal medicine involvement, you can see the patient condition change so dramatically. So I would like to say is, if we see that one person have different stages of the tongue, we should use herbs treat considerably differently. We can't just stick on the same idea. For example, unlike the formula we learned in other modules, like gynecological issues, like fluid issues, those kind of formulas you can apply to the patients in a much longer term, because it's their general body condition, the fluid stagnation, their body characters more vulnerable to the specific conditions. So they need to take maybe months or years to improve, or maybe even that, you can't really see lots of improvement. But for the cold external pathogenic factors, you should expect some change fairly quickly. And you should always keep changing your formula according to the body condition changes. You can't just stuck in the same formula, because, for example, if someone last time had cold, you use A formula helped. You can't expect in second time you use the same thing to help. So that's what I want to see. So you see, what I want to see is compared to the 3 tongue pictures, this picture and this picture, those 2 pictures all caused by damp issues. But you see, what's a big massive difference in between? What's the major difference in between? We all have to resolve the dampness. Can you give a clue what is 2 pictures? If we see the tongue picture like that, what formula we should consider to apply to differentiating these 2 conditions? If anyone want to talk, you just open to it. Otherwise,
well, the middle tongue.
Yeah.
Obviously, there's a yang problem.
Yeah. And
there's damp. You can and probably some qi stagnation as well. You can see the swollen bit around the side.
Yeah.
And then when you move over, it's improving.
Yeah.
But it looks to me as though the damp has moved more to the center a bit, into the central digestive system more.
Yeah.
But it's the one in the middle also looks, it could just be the light, Dr. Chen, but it also looks a tiny bit blue color, just a little bit.
Yeah, the blue is, I think, is more to do with light, maybe.
Yeah, probably the light stagnation. And the tongue on the left, interesting, because you can see the little, you can see the slight swelling on each side of the central groove there.
Mm.
The little swelling. And obviously this tongue doesn't, the one on the left doesn't seem to have much coat at all.
Mm. Exactly.
So huge changes in the tongue, huge changes.
Huge change. I can't even preparing my PPT, I double check, triple checked. I don't even myself. I just think it's not from one person, but it is from one person. And do you just when you talk about, you mentioned about the chi stagnation. These three pictures, which one you think is more likely chi stagnated?
The one in the center, to me,
Mm.
I mean, damp and seems to have damp related, well, it seems to have chi stagnation. I can see more chi stagnation than the one on the right. Well, the one on the left, on the left has got some pockets of chi stagnation.
That's right. For me, in my interpret is the most chi stagnation is the right one, is this one.
Right.
And this one is more fluid stagnation. That's what I
Right.
want. And after the draining fluid herbs being used, I use the Fulling in a high dose.
Yeah.
Fulling high percentage. The tongue picture change like that. You see the line, the yin insufficiency. That's what I want to see. So when we try to resolve the damp and drain the fluid, we can easily, we can get rid of them. Sometimes can be very quickly. The tongue picture can look noticeably slimmer, but you should consider the yin insufficiency. So when you see that, you no longer should able to use. But in this condition, there's a phlegm stagnation in the upper part of the body. So that is that's what I really.
Yeah. I wouldn't want to be, I don't want to be semantic, Dr. Chen, but by chi, water is a chi as well. So when I say chi stagnation, it's a water chi.
Yes.
Even if it's water, it's still a chi stagnation, if you see what I mean, yeah? But it's just a semantic point.
Yeah, it is. Yeah. And of course, in my understanding is, if I see the fluid stagnations, I normally use like a Fulling, Baizhu, this kind of herbs more heavily. Although you're right, when we talk about the fluid stagnation, there must be chi stagnation too, of course. But when we're using herbs, they are different because when we're using the when we see that, when there's chi stagnation, more chi stagnation dominating, and then Chen Pi, Zhi Qiao, Hou Po, this kind of herbs will be more applied.
Yeah, the shape is, the change in the shape is remarkable.
Which that's what I mean. It's really making me consider whether it's the same person or not. But I think the two with angle as well. So the tongue picture, I do find like very recently, I treat someone, his tongue picture, when he showed me, sent me the first picture, his left side, right side is noticeably large. But then I ask him symptoms, he doesn't have any symptom like that. So I ask him send a picture again, and not so noticeable. That's because I think that's to do with angle to take picture. So which is, I mean, that's why the best way is if I take myself, it's much better. So but patients that take themselves is not quite as good quality as we supposed to, but we're still able to help. That's what I mean, I know sometimes people talk to me and say, oh, they don't feel confidence. They just feel hasn't been considered everything. Don't worry, nobody, well, I mean, myself clearly not considered everything, far from it. But we can still able to help. We're still able to help. Even, for example, even if we have 10 problems, if we consider about 6 or 7, they can be very effective. Even some people consider 2 or 3, they still can be works really well too. So don't worry, as long as you keep trying, as long as you keep thinking in a particular way. It's try to, you have a frame, you have a structure, and you try to have some kind of feedback of your, and keep your whole framework going, and then you will slowly develop your own style of the problems. So that's why in this case study, I try to talk about this way, because it's no point to tell what's going on, is waste of time and it doesn't help much. But with that, you can understand with cold damage conditions. In the term of the cold damage conditions, just a moment, the Dean said really, really good. This in the middle, this clearly cold dominated more strongly. That's why the fluid retention more dominating, also the color and the shape of the tongue, and also you see the qi weakness as well, more noticeable. And yet this one, cold is much less, and this one, cold, the least of the cold stagnation. So therefore, even in this condition, we can consider use, for example, like Ma Huang Tang, Gui Zhi Tang, Ling Wei Zhu Gan Tang, Wu Ling San, and so on, to experience the cold. But in this condition, we can use like Xiang Su Yin, Shen Su Yin, and so on, mild ones. And in this condition, we certainly can't use like a Ma Huang Tang, can't use this kind of even Ren Shen Bai Du San shouldn't be considered. So we can, that's what I'll try to use that chart to help you to understand, to distinguish the strengths of the formula to apply to a certain grade, to observe of course, the pulse symptoms can help us as well. But on top of that, the tongue diagnosis can help us to tell how badly the cold stagnation is, and how much the depth stagnation is. You see, for this one, the external depth is the dominating ongoing situation. Although there's fluid stagnation and so on, but there's coating covered evenly. Patient had diarrhea, loose stool, had a bit of no appetite. But this one, although there's cold, but external cold is limited, is reduced, but internal cold stagnation appeared. You see, so that is from that. But in this one, the dampness is no longer dominating, no longer noticeable. I mean, in this situation, we don't need, particularly the yin insufficiency already appear. So we should really avoid use too much pungency and dry consuming yin herbs to avoid further damage to the patients.
Dr. Chen?
Yeah.
On the middle tongue with the damp, a lot of the formulas are expelling to the surface. Yeah, expelling through the surface, Duho, well, Duho can drag down as well, but is the basic principle for the damp in the middle tongue, apart from addressing the yang aspect, is it to drain more rather than push to the exterior?
Myself will be drained more.
Yeah.
You know what? It's because from the patient, the texture of the tongue, from the shape of the tongue, you can see there is a dominating weakness internally. So the yang energy or the qi energy weakness causing stagnation of fluid, stagnation of internal. So if you don't solve that, that's why I use the Ling Gui Zhu Gan, this kind of herbs. Use heavy Fuling, heavy Gangshen, and I also use Huoxiang Houpo, Huoxiang 27, this kind of herbs and so on. But I can't exactly tell you about, maybe 60-70% using to establish internal rather than expelling external.
Right.
And the percentage of that, it's almost impossible to give a clear figure. But in the future, if you practice a few times, you will understand. You will have your own, you have your own measurement of doing it. In fact, like this tongue picture, in this stage, the expelling can be more, but this stage, the expelling herbs shouldn't put too much. Is that clear?
Yeah, I was just thinking, because if the damp is more in the interior and you push to the exterior, you can push the damp into the outer layer. So draining would seem, to me, would seem more appropriate. Yeah.
The great thing is the great thing of the damp. The different thing about the damp, unlike cold and the heat, is the herbs to eliminate the damp. Normally, the resolve and expelling goes together.
Right.
You know what I mean? So
Yeah.
that's the one of the specific characters of the middle warmer. Middle warmer is able to going up and going down. So that is why I think I mentioned this before. Sometimes you treat people as people starting vomiting. Like a very last few days, actually someone in England actually emailed me because interested in China. I can use WhatsApp, but I can't use WhatsApp to download pictures. I can see the message, it's fine. I can even make a phone call, but I can't use download the message. So they email me the message, picture finally. So after I use the formula, I give the formula and then posting the herbs to them. And she told me she had diarrhea, not diarrhea, she had a loose stool every time after about 5 or 10 minutes after she took the herbs. She said she have to go to loo and pretty loose. So I checked the formula. I said, don't worry, because the formula, none of them cause you that, which is actually she's for other issues, but it's really help activating her bowel, activating her middle warmer. But her body decided to shifting her toxins in the bowel. And yesterday, actually last night, actually, she ran me stopped. Yesterday she only went to the toilet twice. But before she goes 3 or 4 times. And before that, before she took the herbs, she go about every couple of days. So I tell her, because it's only, she took about 3 or 4 days. I said, you carry on. This even twice should be reduced to once every day, because the herbs, none of them is laxative. None of them keep her bowel going. None of them is push her bowel out. But her body decided to do that because herbs able to stimulate her digestive system, make her contractions and more stronger. But she does feel generally better because she has stomach pains, she has fatigue, and all those kind of things get better. But she feel, she thought I gave her detox. I said, it's not detox at all. So she said, can I take less? I said, don't worry, it's not detox. You can carry on using it. That's just answer the questions. So as long as you resolve the damp, if you resolve the damp, actually that means our body will decide either push it to the surface to get rid of it to the channel by the pee or by sweating, or going in downwards, going to by the pee or by the bowel. And then in that stage, I have to say, I normally do not control it at all, unless if I found, for example, in certain conditions, if you don't want, for example, like her condition, if she is mentioned, if I particularly don't want her going to that far to the bowel, you can put a bit extra herbs like a lianzi, like a shanyao, to particularly preventing the bowel to loose. We can't do that, but not necessarily a good thing to do. But the do can make our treatment more friendly to fit in their lifestyle. Do you know what I mean? It's just because you don't want them inconvenient, because this is just found, okay, my God, in working, I take the herbs, I have to straight away go to the toilet, where it's such embarrassing. We can't stop that. But otherwise, actually it's not good, because if we use like a shanyao or a lianzi to consolidating the stools, and that could slow down the damp detoxing. But we can do that. that's also one of the reason we more likely in here treating problem with herbs takes much longer, maybe than in the old time, in the past. And the herbs only very strong dose, fitting one thing, get rid of one thing, and then leave for quite a while. So that's the difference. Okay.
Yes, it's a good point you made about you don't see the true tongue at the beginning, yeah, unless you know the client, because the photo on the left is probably closer to her true tongue.
Yeah.
Because when I look at the middle tongue, it could just be the light, but it does look a bit shiny on the surface, a little
Well,
shiny.
I think that is why, I mean, for that, I don't, that's what I mean. For that, that is means the young weakness more dominating.
Yeah.
So if you can grasp the idea what I'm saying, because when the young weakness is dominating, the fluid or the damp will be more flooded. So compared to the all the three, this one is far more watery, far more, like far more water there. That means the young is weak. Like you mix, if you make a dough, like flour dough, you put more water, then it will be thinner. If less water, it will be drier. That's like that. So that's what I try to, to say. If there's a more cold strike, it should be more like that, more like the middle one. So if you see someone have cold symptoms, but the tongue looks like that, so you know they are not old cold. That must be external cold very briefly, because that shouldn't be have such a cold condition.
Yeah, I
Okay.
mean, by the theory, the cold makes the water. Yeah, by the theory.
Yeah, exactly. Exactly. 寒生水, yeah. True. Okay. So we maybe because we are in the British time is 12:30. So you may in my time is 7:30. So
Oh,
you have a bit, we have a lunch break, you have lunch. I have a dinner. Have dinner. So maybe about 40 minutes, 45 minutes, I'll come back. Okay.
Very good. Thank you.
Okay. Okay. Hi, hello everyone. Sorry.
Hello.
Hello, hi. We can start now. So the cold damage disease or external cold damage disease, we have finished. I have to say, in Britain, I mean in China, when I was working here, I think every season seems to have every season's problems. In Britain, it seems less noticeable. So the cold damaged or cold damp damaged diseases is pretty dominating all year round. So I think if it depends on the countries, your own places, environmental elements, characters is, and I think in Britain, certainly the cold and the damp is two major dominating pathogenic factors causing external symptoms. And on the top of that, just more than what I mentioned, the internal conditions more likely damp, cold related as well. I mean, that's to do with lifestyle, to do with maybe environment and a long time accumulation of like the weather elements penetrating into the system as well. So the previous formulas we talked about, like 人参百毒, like 香苏散, like the 生苏饮 and so on, is the most popular, most commonly used formula for myself. And now we're talking about heat attack syndrome. So it's by the pathogenic factors. We talk about cold, we talk about heat now. For the heat or warm or attacking syndromes, that's just more than what I said. Then six channels, like Shanghan talked about system, is no longer applicable. That is pretty important because in the about 600 years ago, in the Ming Dynasty, in later Ming Dynasty, there's a huge pandemic breakout in southern China. In nowadays, Zhejiang, Jiangsu, Shanghai, that region, there is a massive pandemic and claiming lots of lives. And during that pandemic, which is overall, I think it seems like almost half century or even longer, quite a long time. And from lingering on and breakout here, breakout there. And in the very beginning, most of the doctors still try to using the Shanghan system to dealing with disease. But they found there's a problem because the symptoms slightly different than the cold damage disease. And the two major things, they transformed very rapidly and can quickly consuming the yin and the blood and going to the heart and the kidney channels and causing the coma and even death. That's why a genius doctor like Ye Tianshi, Master Ye, Wu Jutong, Master Wu, and Wang Mengying, and so on, feel it really is just as genius as Zhang Zhongjing. They are based on the Zhang Zhongjing system, based on the Shanghan system. They created another system called the Wenbing system. Is epidemic febrile disease, doctrines of febrile epidemic diseases. That's what we call the Wenbing, which is warm or heat attacked diseases. So in that system, instead of 6 layers for the 6 channels transforming map, which is just moment we talk about like a Taiyang, base Yang, and then Shaoyang, and then Yangming, 3 Yang channels, and then going to Taiyin, Shaoyin, and Jueyin and Shaoyin, the 3 Yin channels. The 6 channels eventually get into the Shaoyin, going to the heart and kidney, and causing death. instead of 6 channels, they create 4 channels, 4 levels, which is Wei, Qi, Yin, Xue. Wei is guardian's energy. Qi is the qi, same level with same words with the qi we're talking about, energy, qi. But the real contents of these terms actually not quite the same with the qi what we're talking. Because the qi, normally we talk about qi, it's energy, it's material. But when we talk about the qi aspect or qi level of the doctrines of epidemic febrile disease, is a stage. It's a group of symptom complex. So there's a stage, like 6-channel stage. That's what I just moment at the beginning I said. There is like an indicator, like a marker for cold damage. That channel is 6 channels, 6 levels of getting one by one, getting to finally reach the center of the body. But for the heat damage disease, to reach to that level and eventually completely defeat the person's livelihood, only need 4 stages. So they're much quicker. So the qi is the level, is the stages, is one of the stages, of the 4 stages of heat damage disease. But what is the key? How we found out that? Of course, it's based on the large numbers of clinical cases and very close observations and explanations, also connected, associated with our theoretical system. So it's a greater discovery based on purely based on TCM system. So that's why someone believe there is 2 major development of Chinese medicine, which is the Han Dynasty, which is the Shanghai book. One is the Ming Dynasty, which is the Wenbing theory. One is cold damage, one is heat damage. But I have to say, we can't really see it's developed in the same system because this whole cold damage and heat damage diseases, all the theories or basic theories, or even some detailed theories are already mentioned, discussed in the Yellow Emperor Internal Classic, but it's just more refinedly, more systematically introduced in Shanghai and Wenbing. But what is the key? The key is the heat damage disease is a yin being suffered. That's why Wei, Qi, Yin, Xue. Wei is because Wei Qi, guardian Qi, could be, well, that's actually basically there's a connection, although this means stage is not really material, but actually is derived from this material, the terms. So Wei is guardian energy, Qi is another guardian energy, and the strength of the body, energy, livelihood. Yin is one of the different cellular levels of essence of blood, and Xue is deeper, which is blood, deeper levels of blood. So you see, from that you can see the Wei Qi Yin Xue 4 stage is almost an indicator on how deep our essence, which is more inside of essence, being consumed. So from the very beginning, when the heat energy attacking our body, it's only attacking the surface of the yin, and then deeper in qi, and then deeper to the yin, and then deeper to the blood. And when it comes to the blood, this is basically right to the core or right to the center of the material of yin energy. So if the blood level is being consumed as well, then they come to a stage the patient will get to the end of life. That's how this waiting issue system is. And because you see, compared to 6 level, this is 4 level. So the heat damage attacking the symptoms transforming much more rapid, much more severe, and cause much more death. And also we know the cold energy, the cold, when people in cold temperature, the slower movement. And in the hot temperature, we move a bit faster, which is in the pandemic, epidemic pathogenic factor is also the same. In the cold temperature, the transforming, the infecting to the people not quite as quick, but when it's in the heat temperature, more rapid. So by the experience of the scholars of heat damage disease doctors, so they have very strongly suggestion is when you see the disease, you go to find out a hot heat natured or cold natured, to find out whether it's cold or heat nature, and then have to treat fundamentally differently. Otherwise, you will make a lot of big mistakes. So that is quite important. If you live in a hot country, you have to be more careful about that. As that's the thing. And in between of the heat, between the Wenbing, I have just more than I said, Wenbing, February pandemic disease doctrine of Wenbing is based or is developed based on Shanghai. So there's not a formula very similar, even the name are same, but you also have to be very careful. There's certain herb used slightly different. This is difference can, in the severe cases, can make a massive difference. Luckily, or unfortunately, because it depends on how do you say it. In Britain, we don't have many of that at all. But in the hotter countries, I think there may be much more. For example, in China, in the summer, more heat related to this. And in the winter, more cold related to this, like in northern China, for example, like Beijing, for instance. But in England, even in the winter, even in the summer, still a lot of cold, damp, mild, cold, damp cold diseases, far more popular. So I've been in England practicing Chinese medicine for 20 odd years. It's not many times I see the heat caused severe heat attack symptoms were not common at all. Heat damaged, heat attacked syndromes, probably in my rough number, maybe less than 10% or about 10%. So it's not really common. But in different countries, it's rather common. So I introduce one very classical, commonly used formula for heat damaged syndromes. That is mild one. Is called Yin Qiao San. This formula we've been talked about that in the herbal course. So we know in the herbal course, Jin Yin Hua Lian Qiao or Yin Qiao San. Yin is Jin Yin Hua, which is honeysuckle. Qiao, Lian Qiao, I don't know the English name. Another, and honeysuckle is a flower. We use flower. We don't use honeysuckle twigs. Also can be used as herb, but we're not using for that.
Yeah, Linchao is Forsythia, Dr. Shen.
Or Forsythia,
yeah.
Forsythia, yeah. Forsythia is a fruit. It's a fruit. So one is a flower, one is fruit. And those two herbs, all we use for external heat, but those two herbs, none of them have expelling purpose. They're not pungent, none of them pungent. They're all either sweet cold or bitter cold. But why we don't use expelling herbs? Why we don't use bohe, for example? Obviously, they do have bohe in the formula, but it's much mild dose. Why don't we use the expelling herbs as a key herb to treat a problem? Why we don't use the expelling herbs as a name the formula? Why the Wu Jutong, which is I have a great respect to this Dr. Wu or Master Wu. He have a very deep understanding of Chinese medicine, very deep understanding of the Shanghai Lun, and a very deep understanding of Yisheng, Zhang Rongjing. So he created a lot of formulas and theoretical explanations. I do believe is deeply understanding, get from a deep understanding of the Yellow Emperor, Tang Classic, and the Shanghai Lun, but just used it, applied it in his current challenge or current conditions. I do think that's the whole point of we study. It's the classic things or study is very basic principles, rules of the books, which not make us to just like follow the surface or follow the single herb or single method. It's most thing is the thing behind the thought, behind the formulas and the formulas, under the theories. So he used the yin jin hua lian qiao dui. Why? It's because if the heat damage disease for heat pathogenic factors, we do not need, or we generally don't need too much expelling. Why? Because the heat have a nature of going up and going out. So for example, as long as you open the door, as long as you lift the roof, the heat will steam out. You don't need to expelling it, firstly. Secondly, all the expelling herbs, particularly pungency herbs, they will consume the yin of body fluid. And those yin and body fluid, those things are the most valuable material for us to battling with the pandemic, with the pathogens. So that's why you don't need to do such thing. So that is why, I mean, for me, that is why I always bear in my mind, if I treat heat-related disease or heat pathogenic factor dominant disease, I try to avoid to further over-consuming the body heat, further consuming the body fluid of blood. That is key. Otherwise, we will do more damage than help to the condition. So that is one thing I want to really highlight this on. And I do realize there's lots of people don't really consider this problem. That's why, for example, when we treat cold, when we treat either cold damage or heat damage disease, for perspiration, to induce the perspiration, we have to be careful. We have to be relatively use as short as possible, as effective as possible, rather than just, okay, you casually doing it. Because particularly for the older patients, for the younger patients, for the weaker patients, for the complicated medical condition patients, you can cause major problem. I don't want to mention the details, but during the COVID pandemic, I take part in I have to say it's quite a high level forum about, because that's the early stage about Chinese medicine treating COVID. And that time talking about discuss few cases, which is pretty severe cases. And for a couple of them, 3 cases discussed. And one case was very successful. Another 2 cases not quite so successful. And actually one of them actually eventually passed away quite badly. But when we're talking about that, I do realize, I did mention as well, I do think it could be to do with that time of treatment overusing the expelling herbs. It's because, in that time, okay, they think it's pandemic, you go to do it. But in that time, the particular patient, the condition of patient, the yin insufficiency are really pretty dominating. That's why in such condition, even there is external cold symptom there, we cannot overusing. We have to change it. That's why, like shen su yin. That's why I mentioned shen su yin. You do can, as well as nourishment, as we do able to expanding the toxicity, help pathogenic factors, as well. In the meantime, nourish the essence, and the situation of the patients can be changes dramatically. We have to keep ourselves on top of the ball. We can't just, particularly for the heat damage disease, transforming very rapid. So that's one thing I want to highlight. So that's why, I mean, this case, the time pictures, what I'm showing is that as well. try to show how big the insufficiency can be quickly appeared. And then, of course, majority of case is not like that. I have to honestly say, most of the time, it's quite it's not, because our body is buffalo, our body adaptability is pretty strong. So if slightly warm, slightly cold, it's okay. It's not a big deal. But in particular cases, you have to always bear in mind. So we want to be a very precise, very fine formula given, rather than we just give them roughly, and then we just solve about 30%, and the rest of them waiting for the body to cope with it. If like that, we can't improve as fast as we're supposed to be, as we could be. So in this formula, instead of using spelling curves dominating the formula like a Bohr, for example, like a Jingjie it's all strong spelling curves. Instead of that, the Wu Jitong used Jin Yinghua and Lianqiao as key herb. Why in Jin Yinghua and Lianqiao used as key herb? Actually, these two herbs actually cold, sweet or bitter, they are directly suppressing the heat or reduce the heat. So basically try to balancing the heatness of the heat pathogen. So make the fire weaker, make the strong heat reduce. And also like Jin Yinghua can top up a bit body in or cold or whatever you're talking about that. And the Lianqiao able to go into heart channel can clear the heat, which may be affected by the heat, and then keep the disease more likely in the Wei level or Qi level rather than getting into the Yin and the Xue level. Because Wei, Qi, Yin, Xue is different depths of disease. So Yin Qiao San is a formula to dealing with Wei levels, light or mild symptoms of heat damage disease. So that's the thing. So Jin Yinghua and Lianqiao is two key herbs to dealing with heat generally. Like Lianqiao, Lianqiao can dealing with heat in any stage. In the Wei, Qi, Yin, Xue, 4 level, all can do it. But because Lianqiao is very light, although it's a fruit, also including seeds as well. We do know the fruit and seeds normally heavier, they're going down. But because Lianqiao is so light, if you see the Lianqiao, you know they are so light. It looks almost like a leaf or skin rather than fruit and the seeds. So they're so light. But even in the light, they are seeds, they are fruit. That's why the Lianqiao able to go into cleanse every stage of the heat. Wei, Qi, Yin, Xue, but they good at the surface one. Use Lianqiao as a key herb to cleanse each stage. And Jin Yinghua is good at cleansing Wei and Qi level. Jin Yinghua not really that good going to blood level. Does go to blood level, but not so good going to blood level. The Jin Yinghua, the honeysuckle, I know in Britain there are lots of people like it in the garden, but they all been modified. So I see the beautiful flowers like a purple, like a blue, I even see it, like a lightish blue, beautiful, but we can't use that as a herb. The honeysuckle have to be Jin Yinghua, have to be Jin Yin color. Jin is gold, Yin is silver. So the yellow and the white color to be used as as herbs. And Jin Yin and very fragrant, very nice smell, and relatively sweet. And the Jin Yin is the Fei Wei and the Qi levels color. So that's why Jin Yinghua have to be used. Even in some way, because my neighbor used to have a beautiful, very, almost cover their fence, beautiful honeysuckle flower, but the color is not right. And I tried it, so bitter. It's not and also it can't be used as herb. You can use, can use as can maybe do something else, but can't. It's different nature of the Jin Yinghua. So those two herbs to just directly suppressing the heat or clearing the heat. And yet other herbs, 薄荷, and 薄荷 is a pungency and cold natured, can expelling the heat, or actually soothing the liver, expelling the heat. Whatever you're talking about, it's have a bit expelling purpose. But it's not a key herb. And the 荆芥穗, 荆芥, do you remember when I talk about the 荆芥? 荆芥 is the third or fourth or fifth herbs we talk about in the herbal course. 荆芥 expelling the wind, with that expelling the wind, and 荆芥 have slightly warm nature, so it's not so warm, but it's pungency. So 荆芥 can can hugely help the pores cleansing but without too much top of the heat. 淡豆豉 also is neutral or slightly cold or slightly warm. 淡豆豉 is a fermented black bean, can lift the pores, can open the pores from kidney energy to the lung energy. So you see, so the 薄荷, 荆芥, and 淡豆豉, 3 herbs have pungency, but this pungency is not really push the pathogen out. It just open the pores thoroughly. When the pores of the body, when the skin or our surface being opened, the heat can come out, and yet the 连翘 and 金银花 internally cooling down, suppressing excessive heat, and it makes the pathogenic factors of heat minimize it. So by doing that, to resolve the external heat symptoms are already enough. It is sufficient. But with the heat damage, just more than what I said, the heat will damage the yin, and heat also, so heat will consume the yin, but heat also have a nature, heat going up the body. So heat will get through to our upper part of the body, nose and the mouth, and then will causing the going to our respirational system. That's why very quickly with patients who had heat damage disease, we'll be very quickly developing cough, sore throat. So with cough and sore throat, we also have to soothing the lungs, try to stop the symptoms. So that is why 桔梗, 甘草. 桔梗, 甘草is those 2 herbs. If you remember, that's a very important formula to treat sore throat and infected lungs, or blocked lungs, or kind of stagnation of heat or stagnation of pathogenic factors in the lungs, and very good for sore throat, whether it's caused by like infection or of virus or bacteria, doesn't matter which. 桔梗 and 甘草 is great things to do that. It's because 桔梗 able to guide or lift the herbs to the lung or to the upper part of the body to resolve the blockage, because 桔梗 itself can resolve phlegm as well. And 牛蒡子, you remember when we learned resolving the external heat herbs, 牛蒡子 is a herb, have pungency and also salty. Have those nature make 牛蒡子 able to get into. 牛蒡子 is seeds, so they're heavy, relatively heavier, much heavier. Actually, they're tiny, they're heavy, so they can go into deeper. But also the pungency and the salty thing can resolve or can break out the stagnation of heat or stagnation of fluid or stagnation of blood, wherever the tangible or invisible stagnations. 牛蒡子 can able to break it. So these 3 herbs work together, can make all the visible or invisible damage to the airways, to the upper part of the body, cleared to liberate the lungs without conjunctions, without blockage, without congestions. That should be all enough, isn't it? But there's also another issue. That's why I mean the Yin Qiao San, I think this formula is really beautifully organized. It's almost as beautiful like Shanghai Lun's formula. Because if later on nowadays doctors giving the medical herbal formulas, very rare to see such a formula being thoroughly considered, thoroughly mixed. It's just like, okay, that's for this symptom, that is for that symptom, very straightforward, which is fine, which also work, but really to be just like like a strategic planner or manager or politicians or whatever statesmen, they always have a very thorough, complete thought rather than just do one part. So with heat damage, they will consume the yin. And when they consume the yin, they will weaken the heart. So the water work will be affected. When we talk about cold damage, when the cold damage, when the blood is being affected, urine will have difficulty. But when the heat damage, urine also will have difficulty. But the nature of that is different. The difference is with cold damage, the urine being affected is because yang energy cannot transforming or processing the fluid. So there is fluid inside, but it just cannot get out easily. But with yin heat damage disease, there's a shortage of yin, shortage of blood. The heart channels or small intestines, particularly heart channels, be overheated. So that is why when we treating cold and heat damage disease, we also need to look after the kidney or bladder, but we have to treat differently. So with the heat damage disease, we use herbs to cleanse the heart heat, also have like a diuretic purpose, which is 竹叶 bamboo leaf is the herb we used to do such matter. So that is the formula Yin Qiao San, how the Yin Qiao San organized. So if I use just a couple of sentences to do it, just firstly, directly suppressing the heat, open the pores, and then dealing with the heat caused the air blocked the upper part of blockage, and then drain the heat out of system. That's how the Yin Qiao San has been organized. So with that, so we can understand if we don't, well, Yin Qiao San, all the herbs we can get easily, no problem at all. But if we can't get, if someone really have sore throat, for example, if someone really have sore throat, the tongue, the tips of the tongue really red and have quite bad, like a cough and whatever, and a dry cough, or even a bloody cough, we know how to dealing with it. So we need to use some cold or cool, sweet or cold, bitter, but not pungent. Not like use ginger or onion or this kind of things, because this ginger, onion, garlic, which is this kind of things, lots of people using generally for flu and infections, but for heat damages problems, that's not good at all, because these kind of things will further consuming the yin and causing the symptoms worse. But for cold damage disease, bunged up nose, nose dripping like water, feel shivery, feel back is stiff, ginger, spring onion is great stuff. So that is difference in between. So we go to figure out. So from the pulse, normally cold damage disease, the pulse will be very taut and tight, normally slower, not necessarily slower, but tight, and very like a string being pulled, very taut or straining. That is a major thing. But with heat damage disease, the pulse will be rapid. Will be even the counting may be less than 100 or less than 90, not quite that fast, but will be definitely faster than normal. And most noticeably, which maybe is the beginning you can't tell, maybe noticeably is you can feel the pulse coming in a rush. So the pulse coming in a kind of a jumpy and a rush way, which is because too much heat inside causing it, like a flame. So that is Yin Qiao San. So Yin-Qiao-San being used for lots of heat damage disease, including sore throat, dry cough, like a painful chest, headaches, like bloodshot in the eyes, and also this kind of problems in the heat condition. The pulse will be rapid or relatively rapid, at least in a kind of a rush way, coming in a kind of jumpy and rush manner. And then the tongue tip normally redder. You see some, I have some tongue pictures. You see like that. This is obviously, damp is dominant, but there's heat here as well. You can see there's a tip of the tongue. I have a better picture than that, but I didn't find out. This is the tip of the tongue, but relatively redder than other part. And some tip of the tongue is in like this as well. The tip of the tongue is a far more, looks almost like ulcerized. It looks not as smooth, quite dotted. Or I think you may all heard about strawberry tongues. And obviously the typical strawberry tongue is not very common to see, but you see a lot of tongues similar like strawberry tongues. So which means on the edge, particularly on the tip, there's some far more red dot. That is a typical Yin-Qiao-San suitable condition. So if you see that, you can almost sure you can use Yin-Qiao-San. This is Yin-Qiao-San's formula. The grams I'm giving is the percentage of that. Actually, the classic formula of using it, you only use 6 to 9 grams per day. So you don't use that much. So you can mix them up every day, use only 6 or 9 grams. And if you use the herb, the dried herb, normally for Yin-Qiao-San, you don't need a long time cook. You need a long time boil. So the classic way of using it, Wu Jitong mentioned, Master Wu mentioned is, you just, as soon as you smell the fragrance, after you boil, after a few minutes or 10 minutes, you can smell the herbs and full of the house. That's good enough. And even some doctors in the recent years, they even asking to just use hot water, like brew it like tea. Because if you want to treat the upper part of the body, the herbs have to be used lighter, and the energy should be more kind of a surface, more rushed, rather than long-term boil. So if you want a tonic, you need a long-term boil, make it a heavy, subtle energy. But if you want to treat acute or external upper part heating issues, you go use lighter herb and much more harsh and much more shallow surface herbs. Otherwise, you long boil, you lose the property. Actually, in modern medicine, modern research, we found those kind of herbs, like 薄荷, 荆芥穗, 牛蒡子 as well, 连翘, 金银花, and so on. Those kind of herbs, if you long time boil, the lots of functional ingredients expels, because the smell. When you can smell everywhere, it's less to absorbed by the body. So that's what they. So there are also another new method of using this kind of formulas. Inhaling also helps for sore throat, for the cough, and so on. Yin-Qiao-San not only used for cold, not only used for infections of the UTIs, sorry, the upper respiratory tract URTs, they also can use for hay fever. For example, there is hay fever. I see it's quite a bit as well. They not only have sneeze, they have sore throat, they have dried eyes, like infected eyes. And if that is the case, Yin-Qiao-San is good because there's the same sort of heat stagnant in the upper part of the body. So Yin-Qiao-San not only used for that. Yin-Qiao-San is a formula to dealing with heat stagnated in the upper part of the body, in the upper jiao, we call it 上焦, upper jiao. So there could be more likely is infection, like pandemics, infections, but they also could be other infections, skin complaints, allergic problems. So this is far more wide range usage of that. So in China, there is quite a big different style in a dosage of using the formula. Normally, northern Chinese medical doctors, more likely use a heavier dose of herbs because heavily influenced by Shanghanlun, and also because of cold climate and so on. So they can use so heavy, much more heavier dosage. And yet southern Chinese medical doctors, which are influenced by Wenbing, heat damage disease theories, they must use much lighter herbs. So, if in China, if you see some doctors very considerably lighter formulas, they're more likely influenced by Wenbing. And if you some doctors in here, I see some formulas, some herbs like a dangshen or shouti, they can use 1 day's dosage can be used 200 grams or 250 grams, which is a huge dose for a single herb. And that more likely is northern Shanghai influenced doctors. Okay, another formula is 加减维蕊汤. 加减维蕊汤 also a very good formula, very common use formula. It's because this formula very mild. We said the yin qiao san already is a mild version, mild formula in strength to treating the heat damage disease. But 加减维蕊汤 is also very mild as well. This is suitable for weakness caused, the weakness condition, yin weakness condition or blood weakness condition caused by the external heat damage. That is very commonly happens, for example, with children, with elderly, and also with postnatal, for example, postpartum conditions because this kind of people normally they can, in a way, their body more vulnerable to heat damage. So when the heat is not so bad, they can even cause the disease. To treating that, because they already have a very weak yin or blood. So when you're treating them, you have to be very focused on nourish the yin. And also because normally their body is weak, the digestive system already weak, you also cannot use too much cold herbs. That's what I said in Britain. A lot of people have cold and they already have poor digestive system, but they use lots of cold ice stuff and the cold drinks, whatever. So eventually they have very poor stomach, have other issues. So the problem is dragged on and on and on. It just not got any better. If some elderly can finally develop some pneumonias, whatever, and even causing severe conditions. So when we're treating people like that, also, although they need some cooling, expelling, or cooling, like clearing heat herbs, but because the body is weak, they cannot be used too much cold herbs. So what we do, 加减维蕊汤 is the answer. So 加减维蕊汤, the key herb is 维蕊. 维蕊 is 玉竹. 维蕊 is another name of 玉竹, so it's the same thing. But 维蕊 is a far more beautiful name. 玉竹 also is a good name, but the 维蕊 is even more beautiful. So that's why to treat headaches and fever, slightly intolerant to cold, cough, and sore throat, sticky phlegm and difficult to cough up. Sticky phlegm and difficult to cough up, that means the qi insufficiency and the yin insufficiency. So with the qi insufficiency and the yin insufficiency, also heat stagnation. You really hasn't got much room to maneuver. So it's basically you're handling a very difficult condition because there's heat damage. They consume lots of yin, but the yin already so weak. So what do you do? So the whole idea, you see, less sweat. It means why less sweat? It's because there's not much yin there at all. So it's almost like if you boil your water in a pan, there's already not much water. That's why you don't see much steam. It's not means there's fire is less, but at least there says is water is weakened, so it's less sweat. Dry mouth, that means yin is badly damaged. And irritable, that means the heart yin being affected badly. Red tongue, rapid pulse, all indicating heat excessiveness. So if you see such condition, although intolerant of the cold and so on, you can't really touch Gui Zhi Tang at all, because the Gui Zhi Tang will make this situation 100 times worse. Although this patient need tonic, but they can't cope with the heat tonic. That's why Yu Zhu is being used. Because Yu Zhu is cooling property, nourish the yin, and Yu Zhu very light, white, yellowish white or whitish yellow, and quite relatively light. And it has a great yin tonic. Tonic the yin without create too much cold, and cleansing the heat without consuming the yin. So that's a great thing about Yu Zhu. So in Chinese medicine, we believe there's always kind of a unique qi transforming characters of the plants. Some of them able to do both ways. Just like that's what sometimes I say. I say like a certain herbs able to dealing with cold, able to dealing with hot, but there's herbs able to dealing with either cold or hot. So their logic is somewhere behind that. So we have to figure out of that. So Yu Zhu is such a herb. That's why I use Yu Zhu as a major herb to stabilizing the whole system, to stop the further damage, further loss of yin, and to minimize or to stop the heat further develop. So that's at least we have a kind of a solid ground. And on the top of that is Congbai and Jiegeng. Congbai is pungent. Congbai consumes the yin, but compared to other herbs, for example, compared to garlic, for example, compared to the, for example, like Fang Feng and Gui Zhi, for example, Congbai is far more gentle. With Congbai and Douchi, Dan Douchi, two together, strengthening or expelling or communicating liver, kidney, heart, and lung to get the whole energy stretching properly, whole lifting up energy stretching properly. Why we need to do that? It's because with patients that have irritable, with dry mouth, with less cough, less sweat, and difficult to cough, there's already showing the yang energy of the qi so weakened. So with the qi so weakened, we go to lift the strains of the energy to able to re-establish the defending team, for example. So that is the main thing. And then use Bohe in a kind of a relatively lighter dose to cooling the heat, and also try to open the pores to ready to get them going. And use Gancao, Dazao to nourish the blood, nourish yin. But like Guizhi and Baishao, but not quite as strong as Guizhi and Baishao. And Gancao and Dazao definitely not top up too much heat in the system. Gancao itself is neutral or even slightly cool or slightly warm kind of nature. Normally we believe it's neutral nature. And the Gancao itself actually able to cleanse the toxins. And the Dazao maybe it's warm nature, but Dazao is very mild warmness. So that's with all that, yin being topped up, and the pulse has been opened, the lift up qi or lift up energy being strengthened. Although we do not use direct qi tonic, it's because we worried about qi tonic can be, for example, like a huang qi will create too much heat. Don't want that. So that's we use Congbai and Dochi. And the Jiegeng itself can able to lift the energy up and also have neutral and balanced purpose. That's the whole Jiajiang Weiyu Tang is about. So this formula is very suitable for, I use this formula to treat for postnatal. Let's just a moment, we talk about postnatal conditions to using formulas. For postnatal conditions, in summertime, heat damage disease, Jiajiang Weiyu Tang is really good. So, but of course, you can see this formula, you know the symptoms of heat can't be very strong because this is not have too much strong cleansings. So if there is too much heat in there you do can add Jin Yinhua together to use into it. But normally if I put Jin Yinhua, I also use a bit Chen Pi, try to cope with stomach because it's difficult to cough up, sticky phlegms, and so on are really showing there is a qi insufficiency as well. So we don't want further damage to the qi sufficiency. So you need to be, that's what I mean. Basically, when we're treating such condition like a new mother, old lady, like during the pandemic, first case I treated very old lady, she's 80 something with a high temperature for 3 weeks, and which is pretty, in the end, well, once I sending herbs, her daughter-in-law talking about she's really hasn't got much every day, maybe only wake up for a couple of hours, and rest of the time just like very sleepy, very weak, and hardly eat anything. So the temperature is not more than 38 degrees, but really hot. So in such condition, you cannot, the system cannot tolerate with a harsh, strong attacking herbs. So you go to use something very gentle, very carefully, stage by stage to solve this kind of situation. In fact, this kind of formulas like Yin Qiao San and the Jiajiang Weiyu Tang, if we are using correctly, right condition, then also fairly quickly got a response as well. So the tongue picture, and this moment I said the red tongue, normally not much coating. For this formula, if it's coated heavily, shouldn't be suitable for this one. Normally it's dry, thin, wrinkled tongues, more suitable for such formula. Is there any questions about this formula? Otherwise, we carry on. Okay. We see another formula, the 生麻葛根汤。生麻葛根汤，生麻葛根汤 is much more common use than the 家姜维蕊汤。家姜维蕊汤 I have to say, not as common use as a 银翘散. Maybe for me, 银翘散 is #1 common use formula for external heat attacking disease. #2 will be 生麻葛根汤。生麻葛根汤 is not many formulas, not many herbs in it. To treat adults and children's seasonal epidemics, the symptoms is mainly to do with headache, fever, aches and pains in the body, also like measles, skin rash, and the infections in the eyes, in the face, in the nose, sinus, also like hay fevers, allergies. So to treat with this kind of problems. because this formula is able to lifting up our body's energy and clearing the heat to help particularly for yang ming channel, which is stomach and spleen channel caused disease. So we know in the pandemic, for the heat damage disease, if heat damage to depend on which channel. If it damages the liver, gallbladder channel, liver channel, then normally the headaches on the side. But if they are damaged stomach channel, maybe on the face, or forehead, the sinus, or this kind of part of the body. If that's the case, for example, if the rush, if the sinus, if the headaches, all four concentrated in the front of the face, then 生麻葛根汤 can be used, and it's really good. And also because stomach channel in charge, stomach organ in charge of the flesh underneath of skin. Use this formula. Also use this formula to treating problems who have like boils, like measles, like this kind of skin issues, deeper skin issues. For example, if you found acne, someone have acne patients, if some acne red, burning, painful, but seems much deeper, they're not necessarily white-headed. They may be not white-headed. Like it looks like just like general red skin, but if you look clearly, they are underneath of skin deeper inside. So therefore, that means the heat stagnated in the muscle or in the kind of underneath real skin level. Then 生麻葛根汤 able to lift them up and cleanse them up. So it's quite good to use for that. So the formula is pretty simple. So use 生麻 and 葛根. 生麻 and 葛根 we all learned before. We know the 生麻 is black. 生麻 looks heavy, looks really heavy, black, like steel ones, looks hard. And when you touch it, they are hard. They are really, particularly when they've been chopped, very easily prick, hurt your fingers because they are very sharp, looks very hard. But when you try to lift them up, you will be surprised. They're so light. So they're quite an interesting interesting herbs, particularly when first time I see the herbs, see the samples, they are not being chopped. So they are just quite a big lump of the root. So I thought it must be like, well, it looks very woody, black, looks heavy. But when you lift them up, it's so light because they are only fibers inside, they are empty, they are hollow inside. This nature made sheng ma able to go down to deep and lift the energy up. So it's a great, sheng is lifting energy up herbs. So sheng ma, sheng means lifting up. So that's what sheng ma is good at. Ge have very similar effects, but ge is not black, ge is white. So that's why ge and sheng ma able to lifting stomach, kidney, shao yin and stomach, shao yin and yang ming energy from bottom to up to solve issues of the in that kind of channels. And also because those two channels strongly associated with gums and teeth. So sheng ma ge gen tang also able to use to treat toothaches and gum disease. So if there's gum infection, chronic gum infection, if there's teeth issues, toothaches, this formula also able to treat that as well. So sheng ma ge gen tang, sheng ma and ge gen undoubtedly is the key herb of this formula. But only use these two herbs lifting up is not good enough. We need somebody to supporting the yin, to make these two herbs able to lift from somewhere. You can't just lift from nowhere. That's why we use gancao and shaoyao to strengthen the yin. Shaoyao, gancao work together. Two herbs is the very important common pair of herbs to nourish the yin. A famous formula called shaoyao gancao tang. So shaoyao gancao together to top up the yin, nourish the yin, reproduce the yin, and then enable to supporting the sheng ma and ge gen to lift. to irrigating, to nourish, to eventually to push out or to get rid of the pathogens to clear the heat. So that is 生麻葛根汤. But this formula compared to 银翘散 is really typically good for the 胃分, which means in the lung channels, lung organs or lung channels. But 生麻葛根汤 is good for the 阳明 or 胃 channels, stomach channels. So there's difference in between. And the 加减维蕊汤 is suitable for the young excessiveness or young pathogenic factor cause disease, but with yin and qi insufficiency. So therefore, it's more tonic. So that's the few formulas we treat with heat. Obviously, you maybe feel a bit surprised. Just not we only have the mild versions. We don't have heavy versions. It not means we don't have. Well, of course, we do have stronger versions, but we don't often use, and some of them we can't use. For example, the strongest version to treat heat damage disease, the formula is called 犀角地黄汤. 犀角 is Rano whole, or we use buffalo whole instead. So to really treat severe heat attacking, we need a much more stronger, heavier, cooler medicine to dealing with. The plants, in the end of the day, all the plants, or most of the plants-based herbs, most of the herbs, they are wood, they are plants themselves always have a fire element in it. So they're not quite as able as the animal product and the minerals. So that's why we use gypsum, we use 石膏, use 芒硝, those kind of stuff. And we can't use in England, unfortunately. Luckily, we don't need it. or we need some animal stuff, animal product, like being when Chinese medicine bad publicity, like rhino whole, or now we use buffalo whole, it's banned in China as well. Or also like ox gallstone, 牛黄. I think you remember when I talk about the herbs, we talk about the formula 安宫牛黄丸 is the one to dealing with the severe conditions. But we hardly have a chance to using it. And I have to say in England, I didn't have much experience to using such a very powerful stuff as well, because I can't really touch it. And luckily, we don't really, in England, don't really need much of that. So that's why I just don't go into too much of this. So we just introduce 3 formulas. One thing I want to particularly introduce, one thing is maybe can help you as well. We do, I think you all know there is tongue diagnosis, post-diagnosis, and so on. But in the heat damage diseases, when they come to the stage of yin and blood, there's also another diagnosis method, is teeth diagnosis. So just observing the front teeth of patients. So when the yin insufficiency is so severe, the front teeth of the patients will getting drier and drier. So doctors can, by observing their teeth condition, to see how much their kidney essence is. So if you found, for example, if you see most people's teeth, healthy people's teeth, the enamel doesn't matter the color, it may be coffee color, maybe cigarette color, but they're normally shiny. So which means the shiny actually came from water, from essence. But when the yin is really weak, they're no longer shiny, they're like a dead bone, they are dry. So that means the yin or jing is being depleted severely. So that's another way to dealing with. I just hope you never had a chance to see that, because normally that's a much more severe conditions. Okay, so any questions about the heat damage disease? Otherwise, we have about 5 minutes break.
So they're like, Dr. Chen, they're like herbs as light as a feather. Yeah?
Yeah.
As light as a feather.
Yeah.
And bohei, can you tell me if I'm bohei, I only cook for 1 minute. I just put the leaves in and then it comes out again, yeah?
That's right.
Otherwise, I find that if another problem, if you cook the aromatic herbs for a long time, I find they can have side effects. Just the reverse.
Really?
Because you're losing the aromatic quality, aren't you?
Yes, you're losing it, but I don't know they can create the side effects, but they are, you will weaken them. You will weaken them, for sure. So that's why now, like the granules, the concentrated granules, the oils, aromatic oils, they all extracted with dissolved in the chemical is alcohol. So dissolve them first, and then they cook other herbs second. And then after they've been made, and then they spray the oils back to the granules to maintain the most of the ingredients, functional chemical compound.
All this processing, I think the granules are great and very convenient, but all this processing must affect the chi of the herb a bit.
Oh,
must.
For sure. Yeah, for sure.
Unfortunately, yeah.
Unfortunately, yeah.
But
so far it does work. I mean, that's what I mean. They need more research to figure out how exactly, those kind of things have impact to the herb nature. But again, in most of the conditions we're dealing with, the patient's immune adjustment able to adapt those kind of things.
Yeah, they work very well. And they're very convenient. And when I give people raw herbs and they come back, sometimes I think they haven't taken it. Yeah,
that's a problem.
Too inconvenient. The main problem is if they live in a flat with other people.
Oh yeah.
And the smell.
Oh yeah, definitely.
And
but the inconvenience, the time consuming, it's really put people off.
And particularly if you use the traditional method, boil once, remove the aromatic herbs, boil again, mix the 2 cups together. It's too much hassle, yeah?
Well, too much hassle. Too much hassle. I have to say that since the granules being introduced, the people accepting the convenience, the acceptance of the herbal treatment is almost no problem at all. Before, it takes ages to to tell them what to cook, and normally after a couple of days, I don't really want it. I'd rather have acupuncture or the pills or whatever. They can't really cope with it. But now it's not a problem. Well, I can't see it's never had a problem, but most of the time, no problem at all, even for children. So it's good. It's good.
I think sometimes the granules, for a few herbs, I'm going to be careful what I say now, Dr. Chen, yeah?
Yeah.
For a few herbs, the granules will be superior, just for a few. Because, if you know what I mean, because easier to absorb, yeah?
Yeah.
For a few herbs, yeah? Rather than cook something for 4 hours, no one's going to do it. No one's going to do it.
Exactly. So we've got to consider that. We've got to consider that. We've got to, make the easier to accept. So which is quite important too, I have to say. Okay, so we carry on. We carry on with the formula with that. Just a moment, we talk about two major commonly see pathogenic factors attack the problems. Although the cold, we talked more detailed, more formulas, and the heat, we talk less. It's not really means the heat, it's just simple as that. Heat actually is very complicated and quite a lot of formulas as well, because they, when being cold, heat damage disease system is being established much later. So it's a much more thorough and a more complete system, more complicated system. And but the trouble is, that's what I mean. Normally in England or in Europe, general, we don't see as many, and a lot of powerful stuff we use. Unfortunately, we can't touch, we can't use. And also because that kind of disease so rapidly develop or whatever, and lots of conditions maybe don't come to us. They maybe going to different to hospitals or to the ICUs or in emergency. So that's why we don't see as many. I think in Britain, general talk is less anyway, far less, because there's not much heat there. There's not much heat. There's too much damp and cold. But damp in England is huge. It's massive. And nowadays, I think damp getting more and more is because the lifestyle, I think, is a great contribution to that. For example, in China, I do find in China, lots of people now suffer the damp issues more than ever before. I think it's to do with the cold drinks being introduced, too much, culture has been lost. For example, in Chinese traditional culture, we drink everything in warm, we eat everything in warm. But now the city people, nobody youngsters don't follow that at all. And traditionally, we don't have like ice creams, cold beers at all. We don't have that at all. I think if you know like a Japanese sake, when they drink it, traditional way of drinking it is to warming them up. And the Chinese alcohol exactly the same. Traditionally, even when I was a child, we have special facilities, special like special stuff personally made for warm up the alcohol to drink. But nowadays nobody doing it anymore. Hardly anybody. I think a few days ago, someone warmed up the alcohol. First time I see it for last 10 or 20 years. And all those kind of things bring lots of coldness in the digestive system. And also because we are so far more food to choose, we eat far too more. And old time, maybe most of the people every day able to just have full or 80% full. But nowadays we probably high percentage, 80, 90% of people, every single meal maybe have 110% of full. And all those kind of things make the stomach weak and stomach sluggish, and those directly increase the dampness. Also the physical movement. Even a lot of people going to gym or wherever, which is fine, but traditionally, majority of people have to every day work manually. Even though work manually, if they moving from A to B, they have to work more physically. Like they have to buy a food or buy a horse or buy something. Their bodies keep moving and shaking, which is create lots of young energy. And nowadays we're no longer doing that at all. So all those things made in the current society, the damp became one of the dominating elements of that. I think if you remember, I mentioned it during the pandemic, I wrote articles and wrote things I found in my personal limited observation and understanding. I do think in the pandemic of COVID, the damp is the basic or fundamental character of the COVID. And during my treatment to the COVID, treating the damp is basic, because I do find high 80-90% of the COVID patients, town picture I see, are being coated, completely coated, partly coated, thickly coated, all like that. So it's a clear damp elements involved. And that is really kind of, I mean, that's really kind of shocking, actually. So much damp involved. So for that sense, I do think to talk about damp disease more carefully, more detailed, maybe more useful for your everyday practice. So the damp, just a moment I said, damp directly affect the qi transforming. Damp directly affect triple warmer. Damp directly affect middle warmer. So to treat the damp issue, we have to resolve the damp, because damp, unlike cold, unlike heat, damp make everything slow. That is the damp nature. The cold make everything slow, but cold normally is easy to resolve, easy to warm up. But damp is not like that. Because if it's a Chinese letter, if it's for Chinese, the old writing of Chinese words of damp, including two parts. One part is water, one part is fire. That's damp. So damp itself had heat and cold, dual-natured elements. So that's why to resolve the damp issues is very difficult, because if you warm them up, they could make the heat and damp in one going together, and then it's very difficult to deal with. If you drain them, if you're cooling down them, you can make the damp even become damp and water. So therefore, overheat cause problem, over cold cause problem. So the damp is not a straightforward answers for that problems. That's why damp cause issues. So to resolve damp, we got to keep the transforming going, which is, in the winter, in England, we all know one thing. If the house is damp, if the room is damp, the first thing you consider is try to keep the ventilation, keep the air going. So if the air blows, wind blows, quickly the dampness is going. But damp itself sluggish the energy flow. So that is why when we treat damp conditions, we have to have patience, because damp condition takes ages to resolve. And also every day, because if we're eating too much, we can't absorb. If we're not active enough, it's all can, in the same time, creating more damps to top up the pathogenic factors. That's why we have to be, firstly, careful, secondly, patient to dealing with damp issues. But there is solution too. We have lots of successful formulas to treating damp, although it takes ages to completely clear it. Number one formula, which I use myself very, very frequently, is 藿香正气散. 藿香正气散 is used to treat 伤寒. This is original wording from Song Dynasty's official, classic official, like what's called, like a law binding formula books. In Song Dynasty of China, the government edited a book which is have the nowadays the I don't know English name. Now they're like legal documents of to follow, everyone to follow. And they also in Song Dynasty set a lot of small hospitals, small like outpatient place or herbal pharmaceutical places, and they have ready-made all follow this book to selected hundreds of the very effective formulas to ready-made, and then the dispenser only take part of it, small amount of it, give to the patients. So it's a very great idea, really, almost like, and that is about 1,200 years ago. They have such a complete system. And the 藿香正气散has been clearly recorded in that book. This is my translation here is from that particular book, directly translated words by words. So 藿香正气散is used to treat 伤寒 headache, body fever. Shanghai means cold damage, body fever and intolerance to cold, cough and asthma. 5 kinds of exhaustion. They doesn't mention what 5 kinds of is. They could be means 5 kinds of organ or 5 kinds of elements, and 7 kinds of injuries. This is all kind of so-called injuries. 8 kinds of windy phlegm, which is because this go to different channels. 5 kinds of hiccups, abdominal cold and pain, nauseous and vomiting, diarrhea, babrogamy, seasonal pandemics, malaria, swollen, pronatal and postnatal aches and pains, infantile malnutritions. That's basically cover every single problem. So there's a quite a wide use. So you may think, oh, wow, how could it be like that? That is means 藿香正气散 able to resolve the damp, and the damp can create or develop all sorts of various conditions. So that is just showing that. So you don't need to religiously follow what they are saying, but the major symptoms 藿香正气散 good at to treat is like nauseous, vomiting, diarrhea, those kind of problem, which is all caused by damp, stagnated, or attacked digestive system or middle wormer or triple wormer. Middle wormer and triple wormer basically the same thing, because if you middle wormer being affected, the triple wormer will be affected, because the middle wormer is the center or it's the pivot, because it's an exchange point. So if the exchange point is junction, if the junction being blocked, the whole system being blocked, obviously. To resolve the blockage of the whole system, you go to resolve the middle anyway. So that's what this 藿香正气散is about. So 藿香正气散 able to expel external dampness and resolve internal dampness. The dampness could be mixed with cold. Dampness could be mixed with heat. Doesn't matter with mixed with cold or heat, as long as damp is dominating. 藿香正气散 is a great formula to use. But if the 藿香正气, if the damp mixed with heat, then 藿香正气散 less good than mixed with cold. So 藿香正气散 more good at cold and damp mixed attacking, and damp dominated. Just a moment we learned the 人参败毒散, I also said has to do with a cold and damp mixture, but that is more tools on cold more damaging. So if it's cold more, what symptoms could be? Headache, stiff neck, like aches and pains in the body. But what is more likely damp dominated? Diarrhea, vomiting, headache, the frontal head, bunged up nose, those kind of things. So you can tell the difference in between. So there's it's quite easy to find out the difference in between. But if it's heat really dominating, like just more what we talk about, like difficult to cough up, the tongue is red, 藿香正气散 not suitable, because 藿香, particularly in this formula, 藿香is quite a high dose. Especially there's 2 kinds of varieties of 藿香, and one kind of 藿香pretty pungent and pretty dried up. So therefore, they can consume the yin. Therefore, if there's a clear heat and yin dominating conditions, then 藿香正气散 is not suitable. So really, 藿香 far more consuming the dryness than 紫苏叶. We learned about 紫苏叶 and 藿香, they're similar, but 紫苏叶 far more milder in the damp resolving, but 藿香 more stronger to the damp and the damp resolving. So 藿香, 紫苏 is more likely going to cold side, 藿香 more likely go to damp side. that's one thing we have to be very aware. For example, if you see the tongue is a widely coated white, or like kind of a slimy, slippery, 藿香 is great stuff to use. But if it's a cold, like a more watery, like a not very thick coatings, 紫苏叶 is great stuff. And the 藿香正气散 formula is this. Actually, I think you must be remember, I talked about 藿香正气散 very so many occasions. And if you remember, it's very easy. I repeat again, where we understand, you can remember it very easily. To resolve the dampness, you go to use key herb, 藿香, to expelling the dampness. Of course, it's no doubt at all. But 藿香is great to expelling the damp, but 藿香to expelling the cold, not as good. So that's why the 白芷 and the 紫苏叶 as two herbs to help 藿香 to resolve that. 白芷 we learned, 白芷 itself is great cold expelling herbs and also able to, because 紫苏, 白芷 is Angelica, but it's not Angelica sinensis, not Dong Kui. It's another Angelica, I can't remember, D something. This is Angelica Dagaricia. Yes, that's the one. Yeah. So they are very fragrant, very nice smell. So they resolve the dampness. And most importantly, 白芷 able to go into Yangming channel, go into stomach channel, go into the surface, go into the face. So it's very, I like use 白芷 very much to treating lots of problems. And the smell, some people like it. So 枳 is means fragrant, aromatic herb. So some people old time use it to, well, the smell not really like what normally we smell, like like a perfume smell, but it's quite a strong, unique smell, sweetish pungency smell. So not bad. So 白芷 and 紫苏叶, one's root, one's leaf, both of them able to help 藿香 to get rid of the stagnation of cold and damp. So that is a key thing. But if, for example, if it's a Western way of using it, that's enough, really. In fact, 藿香alone can solve a lot of problems as well. Vomiting, diarrhea, nauseous. 藿香alone, in the folk medicine and in the countryside, if some people don't they don't need to have to go into a doctor. If they feel like that, they can just collect a couple of 藿香, they boil to the herbs, or even they squeeze them, mash them, and they drink this juice, and they can solve the problem. It's not a problem. They do able to do that. But again, that is not what Chinese medicine is supposed to do, because that's not thoroughly considered for this condition. So if we treat the 藿香condition, damp condition, we go to treat the damp itself, also the damp related relations or compacted organs. So we know the damp, number one, will weaken the digestive system. The number two will sluggish the whole qi transforming mechanism or qi transporting system. So we need to resolve the fluid, resolve dampness, activating the digestive system and stimulating the qi transforming program. So that's basically this formula is about. So we use the 白芷 and the 紫苏 to help 藿香 to resolve, to get expelling the pathogens. And in the same time, we use 桔梗, 厚朴, we use 桔梗, 厚朴, 大腐皮, and 陈皮. You see, remember, 桔梗 to lift the qi going to the upper burner, 陈皮 to do the middle burner, 大腐皮 to do with the lower burner, and 厚朴 can do upper, middle, and some lower as well. Can do 3 channels. The 4 herbs are able to able to activating the qi or stimulate the qi to make the whole qi system function properly. And in the same time, to use the fuling, 半夏, 白术, actually it's 半夏曲, fuling, 半夏曲, 白术, to strengthen and 甘草 to strengthen the digestive system, to strengthen the qi, to make the earth energy strong. So that is basically how the formula is organized. So it's not only resolve the dampness itself, and also to try to repair the dampness that cause damage to the qi. Use 白术, use fuling, use 陈皮 and so on, and yet try to stimulate whole qi transforming program to restore the activity of qi transforming program. So that is formula. And on the top of that, use jiang, ginger, and date. Jiang and 大枣, 姜枣, to harmonizing the system, to top up the fluid, top up the the essence, to fix the issues. Because the 藿香正气散 so focused to do such condition, so focused on the damp, resolve the damp cause damage cause issues. So that's why 藿香正气散 able to dealing with all sorts of symptoms or conditions as long as they caused by either short-term or long-term damp damaged diseases. That's why 5 kind of exhaustions, 7 kind of injuries, 8 kind of the windy flemish damages, 5 kind of hiccups. That's why I can treat so much broad range of the issues. And in England, for example, over the years, I used 藿香正气散 to treat like very commonly like a stomach bug, like a norovirus, COVID, like indigestion, Hase hernia, chronic Crohn's, chronic bowel symptoms, and food intolerant issues, hay fever, stress, you name it. So many problems. Or could be ME, like ME, I use 藿香正气散 treat ME very commonly. But when we say that, the few things have to be, for myself, few things I normally more careful to use, more sure to use 藿香正气散. If the tongue coated heavily, particularly evenly covered, normally I use 藿香正气散. Like this kind of a patient condition, 藿香正气散 can be used. But you have to be careful, there is heat in the heart channel. So as long as the major symptom stops, you go to stop. Otherwise, they can be further consuming the yin, can cause insomnia and so on. So there's so many conditions 藿香正气散 can be used. I have to say,
Dr. Chen, one question.
Yeah.
Long-term damp. I kind of, and you've mentioned this before, so I'm just repeating what you said. Also has to deal with the kidneys.
Yeah.
And this formula doesn't do much. I mean, it's a great formula. It doesn't do much to the kidneys. Well, there's no particular herb specializing in the kidney in there.
Not at all. Not at all. Yeah, this doesn't do with the kidneys at all. 大腐皮 itself can drain the fluid, can detox the large intestines and the water work, but none of them nourish kidney. No, none of them can. So it's basically to do with damp. It's not to do with fluid. Not to
So it's the pathogen, not the function.
It's to do with mid-wormer, and the maximum is to the triple wormer, but not to do with kidney, for sure.
Thanks. Yeah.
But you see, the kidney normally is not a lot to do with damp. Normally, kidney to do with fluid or water.
Yeah.
So so that's the difference. So if you see, for example, there, for example, like this kind of condition, you go to deal with fluid, not only damp. Okay, is there any questions? If not, we carry on talking about this case. This case is a COVID case. It's very recent actually. It's because my old the pictures too many. I couldn't find I couldn't find which is which. So that's why I just it's very recent. I think it's less than 3 months, probably 3-4 months of the conditions. So the very beginning, that's what I mean. That's very big. This first picture is the COVID positive, and I think that's about 3-4 days. You see, from that time, what you can tell, there's lots of dampness, isn't it? Yeah, you can just open all your speakers. We're not many people, 6 of us, so we just can talk where you like to talk.
Dampen a little heat. Slightly
you-
yellow it looks on the photo here anyway.
Oh, right. Yeah, actually, it's not much yellowish.
Okay, so more damp cold. Yeah,
For
okay.
for me, in that time, I treated. Yeah, well, what do you think will treat you? Which formula you will? Well, which formula, which herbs will you consider?
For the damp.
Yeah.
Well, the spleen group
Mhm.
and the external expelling damp group, and some chi, and then activate the chi from the middle. Activate the chi, probably in all, basically, definitely the upper and middle jiao. So Chempi, Hopo, yeah. So closer to the last formula you just covered.
Yeah.
Yeah.
Yeah. So which herbs or which can you mention few herbs that?
Yeah. So
herbs
for
you
spleen team, yeah,
consider?
maybe Baizu, Fuling, and then then the you could think about the Qingho, Duho, and then for the sort of Qi, Chenpi, Palpo, something for if it was cold. I'm assuming it was more cold damp, something to activate the yang. That kind of group. So the spleen team, the external clearing team, something to drain, that kind of stuff.
Right. Anybody have a different ideas? Yes, just talk freely, no problem. Anybody? No. Yeah, it's very similar. I think you get maybe like 80% or even 85% the same with what I'm thinking. But there's a couple of things you haven't mentioned. From this tongue picture, obviously you can tell very obviously, and then also from her explanation as well, she's long time suffering stomach issues. She long time suffer, the digestive issues. She got some inflammation in her, so the endoscopy showing some inflammations in her stomach, and she's about 30-ish, and she's kind of suffering chronic fatigue kind of conditions. And from the tongue, you can see right in the middle of the tongue, there's a huge lump of stagnated damp, isn't it? And also this tongue picture compared to the tongue picture we said before is much thicker and much kind of slimy, greasy, which is the energy of kidney, energy of lower burner, energy of transforming the turbidity to light energy has basically stagnated. So you need something to activate in the middle, to burst the middle burners in order to break down the kind of stagnation. And also, interestingly, herself is Chinese medicine doctor. She's trained in Chinese medicine for quite so many years, 8-9 years. She got a master degree in Chinese herbal medicine, and she tried like Huoxiang Zhengqi and those kind of formulas to dealing about, but the thickness of coating hasn't changed, and also her COVID test still positive, as it's about a week or 2 weeks or something later, days later, she is still positive. So she was worried and she coughed badly. So because of that reason, so what I focus on the top of the Huoxiang Zhengqi, obviously I use Huoxiang, I use the whole paw, just a moment they mentioned the whole paw. But I heavily used Cao Guo, Zhu, and also I used the Sangji Sheng, those kind of herbs, try to activating Sheng Ma, Ge Gen, activating the kidney, activating the Shao Yang energy, the Wudi energy, to keep the middle warmer stagnation breakout, and also try to accelerating the turbidity transforming program going. So it's almost like keep the system going. So I give the formula. It's about 3 days later, it's the second picture. And that time she already negative. The COVID test is negative. She's feel really encouraged. And interestingly, she feel her energy better than before. And the tongue picture, not what we really liked, but it's far better than the first one. But very interestingly, that time the color of her tongue is being colored. That's what I'm worried about. Wow, maybe I use too much hate herbs, because actually, they like Zhu, like Huoxiang, they are warm natured. But she think probably it's her tea or coffee colored, which she said she did drink some colored stuff, or she drank the herbs as well. I think it's a half an hour or an hour ago, but it actually shouldn't be like that. So I asked her to carry on using the herbs for a few more days until symptoms are completely clear. And then few weeks later, that is gone, a few weeks later, she sent me another picture, because that time she's starting suffering fatigue. She have a bit of it's negative, isn't completely, but she's starting to have a bit of cough. And that is picture. You see, if you compare this picture with previous, particularly the first picture, you can see the congestive middle is completely disappeared. Instead, the kind of, from pictures looks like, the kind of slightly shallow, slightly ditched, isn't it? So it looks almost like the middle warmer is not congested, it's weakened. I do think that's what, just a moment, what I said. When the damp damage, that will make the qi of middle warmer weaken. And it really, middle warmer's qi weakness is a root cause of congested middle warmer. So therefore, when this kind of physical stagnation is gone, or current physical stagnation is gone, or pathogenic factor is gone, the weakened qi showing more noticeable. But because this qi weakened, also because maybe after a few weeks she's panicking or worrying and maybe not good rest, you can see there's accumulated heat and fluid started. So carry on, you see, in this stage, which formula you will consider? Do anyone have any ideas?
Well, I think someone else should have a go, really, because otherwise I'll just. I would consider adding some herbs that will drain damp in the center with a cooler nature, like Yunluen, and so activate this, continue to activate the center, but
Mhm.
not overheat it. And so I would be looking more at the cough could be coming from phlegm created in the center.
Mhm.
And so it's regulate
So for the cough,
downward direction.
for the cough, can you give a herb for the cough, or give a couple of herbs for the cough, or even formulas for the cough?
Well, lots of formulas for cough. It would depend on the nature of the cough: short cough, hacking cough, compression cough, damp
It's
cough.
like her tongue picture like that. If she have cough, so what will? Well, she think is because of long COVID. So what do you think? If
Well,
it's-
we know that a cough must be caused by the lung qi rising going up in the wrong direction. So we know that just as a theoretical principle. So first thing is to I think maybe I'm going to pronounce it wrongly, but I always get them the wrong way around, whether it's Jing or Jing-Jay, but the herb that, so first of all, lift the lid on the lungs, and then add a herb for downward, 1 or 2 herbs even, but certainly Chenpi can help in the formula, but add a herb that will bring the lung qi down, definitely. So liberate it both ways, upwards and downwards. Yeah, to get the qi mechanism of the lung working properly. In fact, I would go, even from the beginning, I would have a couple of herbs to try to shift the qi right the way through all 3 burners, both downwards and upwards.
Yeah.
So go from top to bottom. Yeah. Precisely which ones would there's the number of options. So I would say maybe a couple of herbs. I mean, some herbs you can use for whether it's heat or cold, but something like lifting the qi on the lungs, which is a principle you taught us for removing damp.
Yeah.
And secondly, bring the lung qi down. And I'm presuming from the tongue that the damp must be affecting the lungs to some extent. So that means treating the spleen, herb-like. A herb, upper jiao herb, like the qi regulator for upper jiao, more one of the 4, not maybe ZK or Zi Xiao, something like that might be help beneficial as well. Something like that, Dr. Chen.
Okay. Does anybody have any ideas? James, maybe? Sorry. Have any ideas to use that? Any herbs? Give you a couple of herbs for the cough. If like condition you see such, this kind of a tongue picture is very common for long COVID cough, which is basically you see the upper part of the region, this part of the region, like a bit like swollen. I write it down like I have a hat in the tongue, like a hat being put it on. So anybody have any idea again? Any ideas about that kind of? I use, that's just a moment what I said when we're talking about like a 白钱. I use 紫苏叶、射干、白钱 and 生姜. Sometimes maybe 半夏. It's like a group. Sometimes use 3, some use 2, some use 5 altogether to dealing with this kind of a long COVID chronic cough. The idea, just moment Dean said really well, the idea is correct, just open, shifting, activating the 3 burners energy, which is totally correct. I totally, agree with that. Just which herb able to do that? Do you remember when learning the phlegm, resolving the fluid issues, the modules, if you look back, like a 射干麻黄汤, of course we can't use 麻黄, we can use 苏叶 with 射干 to open the lungs to try to lift or try to resolve and lifting this kind of congestions or stagnations of that. And in the same time, I use 白钱 to reduce cough, resolve the phlegm, which also is from Jinkyola's previous modules. So I gave her the form. Of course, in her condition now, the middle warmer, we should not any more depletion. We should activating and promoting. To activating the middle warmer, the best formula to activating middle warmer, what it is? Do you remember? 四君子汤 or 四君子汤 modified 四君子汤. So I used 党参, 白术, 茯苓 and so on. But that's all been mentioned. But didn't mention 薏仁, but I will not use 薏仁 in such condition. It's because with such a, although there's damp, but with such a shallow and weakened intern, you don't want, I will not use any herbs to further drain them down because that will weaken the system.
But I stir fry them or bake them.
That is stir fry them only able to have the minimize the cold nature, but you can't change their draining and downward nature.
Right.
Yeah. So I will use things like I normally use like 麦芽, 谷芽,
Yeah.
神曲, those kind of things.
Yeah.
To lifting them up, to perk them up, rather than depleting them. You know what I mean? Because this tongue pictures you can see it's like that. So after about I think about 2-3 weeks, it's quite a long time. 2-3 weeks treatment, the cough is cleared, and the tongue pictures became like this. So in this picture, you can see they're still far from good. Even the final one, which is this picture, maybe it's before I get back to China, maybe it's about 2-3 weeks ago. She's not quite all right either. But since this picture, she doesn't have any symptoms. She feel okay. She feel fine. So she said, does she need any herbal treatment? But I told her, you see, from this time picture, you can see her both sides of we call the lung region or lung area, still not quite in a smooth shape. So fluid stagnation or whatever, still pretty noticeable, Qi stagnation and so on. So that's why after about, I think it's a week or so of treatment, it's became like that, which is a bit better. I mean, that is what I said, that damp and the Qi stagnation nature is in the character of her body. Maybe, well, I don't think she can always like others, which is we're all different, obviously, but we can see there is bit improvement as well. So that's basically what the case diagnosis. You know, from the beginning to the end, you can see these two time pictures. It is rather different. The coating is different, the shapes are different, texture is different, and the body's condition is different. So by doing that in a different stage, the formulas we have to use differently. We can't use one formula, get it all through those whole stages. But at least eventually the damp, not quite as dominating. External damp basically is resolved, it's disappeared. This is about this case. Is there any questions about this? Well, you all can talk. You all can talk.
Dr. Chen, in the last photograph,
Yeah.
in the lung area near the tip, there's that little indentation or patch, isn't there?
Yeah.
So that's some indicating some deficiency.
She's not have any symptoms. That's what I mean.
Right.
Actually, from the tongue, we can see she's not right either. She's not right yet. Yeah. But I mean, that's the thing. The trouble is, you know, we believe tongue diagnosis, we believe post-diagnosis, but not everyone believing it. You know,
Yeah.
so it's very difficult. Some you say, oh, you know, you should maybe carry on some treatment a bit longer because this and that, and she probably think she's fine. She's better than before even. She feel okay. So then if like that, we can leave it. But I do give her advice to some exercises, breathing exercises, whatever. But I don't know whether she will do or not. But you see, I know there's still quite a lot of problems from the right pictures. The last one pictures I shared here. She's still quite a few issues. But I mean, as well comparatively, compared to the previous ones, is
Much better, transformed.
It's improved. It's improved. Yeah. Okay. So we maybe have another 5 minutes, or maybe I carry on, or maybe just have a question, anybody? I just try to, I know it's a big, this last topic we're talking about, I just try to, make you more understand what I'm trying to talk about. Can, have more ideas how I use formula, how I'm thinking about it. Actually, that's what I mean. It's quite simple. So for instance, like this form, like this middle stage, when she's worried about she have long COVID cough, her major symptom is a cough. But then you can tell her like a hat on top. So there's fluid stagnation. But this kind of fluid is not in the middle, it's not in the lower part of the body. So of course you will resolve, you probably will drain, but mainly you have to lift up and shift them and get rid of them in the top, or at least open the blockage in the top. So that's how you're organizing your formulas. Because most of the herbs, not most of them, some formulas you're treating with cough. It's just like normally we think, you have to suppressing the air, suppressing the qi, sending down the qi, and so on, which is fine. It's all correct. But depends on the patient condition. We also have formulas like a ma huang, like a shegan, this kind of herbs. They're not sending down the qi. They lift the qi. They open up the qi. So in my opinion, in this condition, that's what she need. So that's why I want to say, and also you see, good thing is about compared to first and second picture, her middle wormer stagnation is disappeared or not noticeable at all. And the lower part of which is picture can't see it very clearly because she didn't use the flashlight, but you can see, just about it, I can see there is not too much stagnation. So therefore, that's why I use the lifting, opening, lifting, resolving herbs, stop the cough and resolve the phlegm. That's what I want to share with you. So it's not really complicated. So sometimes, people come to me and say, I tried so many doctors, tried different people and it doesn't work. But I give formula, it works. So how it worked? Just because I analyzing the conditions in a kind of, actually, if we talk about it, it's not complicated at all. We just need, we need to trust. We need to believe our theory. We need to going back to our original. So we should not misled by some terms and concept of modern medicine. You know what I mean? It's all long COVID, something, always, and if we jump into some set ideas, we probably...
Dr. Chen, in terms of lifting up and down, I'm going by the theory now, so please forgive me. You're probably going to lift, by the theory, you lift more from the left, from the liver qi, by the theory. And then the lung, you pull down more on the right side by the theory. Would that be, so you push the liver qi up. So Sheng Ma, for example, Sheng Ma, Chai Hu, etc., etc.
Yeah.
And then the lung qi you can push down, Si Zhu Yi, but other herbs, quite a lot of herbs push the lung qi down, Jing Ren, Tao Ren, quite a lot, yeah. And then you have to liberate, as you said before, you must liberate the lung because the lung is an endpoint. So it's got to circulate from the top down again. And so you're getting the left-right circulation, if you see what I mean.
Yeah, it is. So obviously, Chinese medicine, we don't exactly know how the lifting and the sending, how the herbs is working, but we know roughly the qi transforming mechanism nature is going. So as long as we're doing that, as almost like that's normally what I think. As long as we understand or able to communicate with our body conditions, actually our body will find a way to doing it.
In the theory of left-right circulation of lung and liver, one side of the tongue is the liver, the other side edge is the liver, the other side is the lung, and it's moving in a circle clockwise on round the tongue.
No, that theory is much more modern, and it's not really the most traditional tongue. Traditional tongue diagnostic method never talk like that.
Okay.
The left and the right, the left up and the right, which is been what our words is, it's been borrowed from the body system to the tongue. I don't really think it should be like that.
But it's east and west, so that's going right the way back to that's going back to before the Neijing even. East and west, isn't it?
It is.
It is east and west. Yeah.
Yeah, but in the tongue picture, it's not quite. For example, in the classical tongue diagnosis, both sides on the side edge is to do with liver.
Right.
Yeah, it's not means this side the liver, that side the lung. No, lung is in the upper part, or the 1/3 part of the tongue is the lung region. And the edge on the side actually is to do with the liver, because the liver itself able to up, also able to down.
Yeah.
That's what we say, liver 主疏泄. So but I mean, I do know nowadays some tongue diagnostic method. They try to make them very clear cut like that, which is if we have time, we can talk about tongue diagnosis further. It's not necessarily, not necessarily bad idea. I think you can look back, the first module I talked about diagnostic chart. I put a few pictures of tongue pictures. You can tell from the much older one and relatively old and a relatively new one, you can see there's difference in between. Okay.
Thank you.
No worries. So we carry on to next one. Another damp formula called the 三人汤. You see, before I go to 三人汤, we see these two tongue pictures. You see from this tongue picture, first the first one, this is the same person, but the before the treatment, you can tell there is damp, isn't it? Clearly there's damp. But you also tell there is clearly heat, although maybe it's picture not so clear, but you can see there is heat. They're much more redder than that. For example, this picture and even that picture, you see this picture has a bit heat, but far less noticeable. You almost can ignore. Almost like the heat being, although there's heat, but heat is not winning above the damp. So it's been completely covered, erased by the damp. But this one, you can't really see heat at all. And this one, you can't cut, although there is heat, damp strong dominating, but still, even in the damp covered regions, there is red dots coming up. So in this condition, do you think 藿香正气散 suitable?
No.
No.
Too hot.
Too hot, exactly. So that's one thing that's what I just a moment I said. One summit I was involved, I was taking part in talking about the case. It's just like that, because the clear heat dominating, a clear heat appearance showed. Sorry, there is a clear, strong